The pregnant nurse had barely settled into the last chair when the man with the dog walked in, and the dog stopped everything. 8 months along, still working 12-hour shifts, still getting talked over in every briefing, Nora Calloway had learned to take up as little space as possible at Hargrove Memorial Hospital in Port Carver, Oregon. She was used to being invisible, but the retired military working dog that entered the ER behind his handler didn't see invisible. He saw something no one else in that waiting room could see. And whatever it was, it made him plant all four paws and refuse to move. The room went quiet. Nora's face went white, and nothing that came after that would ever go back to the way it was. If this story already has your attention, stick with me. Follow this channel so you don't miss how this ends. Give it a like if you want more stories like this, and drop a comment with the city you're watching from. I genuinely want to see how far this story travels. Now let's get into it. The emergency department at Hargrove Memorial was the kind of place that ran on controlled chaos on a good night. Port Carver sat on the Oregon coast where the weather came in sideways off the water and the fishing industry kept the trauma bays busy from late autumn all the way through spring. The hospital wasn't a research center or a teaching facility with a national reputation. It was a working hospital in a working town, underfunded like most regional medical centers. Its staff stretched thin in a way that had become so routine that nobody talked about it anymore. Nora Calloway had been a nurse there for 14 months. Before that, she'd been other things. Things that didn't come up in her personnel file because she'd deliberately left them off the application. She was 32 years old, 32 weeks pregnant, and standing at the edge of a 12-hour overnight shift in scrubs that no longer sat right across her midsection. Her lower back had been quietly destroying her for the past 3 weeks. She'd started keeping a small notebook in her left pocket where she tracked her blood pressure readings, because the headaches that had been coming on since Monday weren't the ordinary kind, and she knew it, even if she hadn't said it out loud to anyone. She was good at not saying things out loud. She picked up a chart from the nurse's station at the start of her shift and didn't notice that her hands were swollen until she tried to grip the pen. "You look terrible," said Delia Marsh from across the desk. Delia was a charge nurse with 22 years in the department and the kind of directness that either comforted you or leveled you, depending on the day. Tonight it was somewhere in the middle. "Thank you," Nora said. "That wasn't an insult, it was an observation. Sit down between patients. You don't have to be standing every second." "I know." "Do you?" Nora looked at her. "I know." Delia let it go, but her eyes tracked Nora for the next hour, the way they might track a patient who'd been cleared but who still looked wrong. The ER was moderately busy. A Friday night in early November, the kind where the cases came in steady but not yet overwhelming. A construction worker with a hand laceration. 2 adolescents from the same car accident, both stable. An elderly man presenting with chest pressure who turned out to have esophageal spasm and ate the antacids the attending offered him with an expression of deep personal relief. Normal work. The kind Nora could do in her sleep. She'd been doing it in something close to sleep for most of the week. Around 9:30, she finished a patient assessment and went looking for a seat in the secondary waiting area, a narrow alcove off the main hall where staff sometimes retreated to chart on tablets or just stand upright without anyone asking them for something. Every chair was taken. There was one left at the far end of a row of connected plastic seats, and she made it there just before her back announced in very clear terms that it was done with standing. She sat down carefully, the way you sit down when your body has become something you're negotiating with rather than inhabiting, and pulled up her charting app. That was when the double doors opened and the man came in with the dog. She noticed the dog first. Most people did because German Shepherds weren't common in emergency waiting areas, and this one moved with a quality she recognized without being able to immediately name. Controlled, deliberate, the kind of movement that came from years of training overlaid onto an animal's natural alertness, so that even at rest the dog looked like it was working. He was aging. She could see it in the gray threading through the fur around his muzzle, the slight stiffness in his right hind leg. But he moved with the confidence of an animal that had never once questioned its own competence. The handler was a tall man, somewhere in his mid-30s, wearing civilian clothes, jeans, a dark jacket, boots that had seen actual use. His left arm was held carefully against his body, not in a sling, but with the specific stillness of someone managing pain they'd decided not to advertise. He had the kind of face that didn't explain itself, a short beard, and eyes that moved across the room in a single sweep and clearly recorded everything they found. He checked in at the desk and then turned to find a seat. There wasn't one. His gaze landed on the empty space beside Nora, a narrow gap between her and the wall that technically fit a person if that person didn't mind their shoulder touching the plastic armrest. He walked over and stopped in front of her, the dog sitting immediately at his side. "Mind if I squeeze in?" he said. His voice was even, unhurried, the kind of voice that didn't waste anything. "Go ahead," Nora said, and shifted slightly toward the wall. He sat. The dog, who had been perfectly steady up to that moment, sitting at a clean heel with his attention forward like a soldier at parade rest, suddenly stopped being still. Nora didn't see it happen so much as she felt it, a shift in the air. The dog turned his head toward her with the slow, deliberate certainty of an animal that had just detected something and was now processing it. He didn't bark. He didn't growl. He simply fixed his entire attention on her midsection and stayed there. "Ranger," the man said quietly. The dog's ears moved, but his eyes didn't. "Ranger." Firmer. Nothing. The dog planted himself in front of Nora, his body angled between her and the aisle, and stopped responding to commands entirely. People in the nearby seats had noticed. The construction worker with the bandaged hand was staring. A woman across the row lowered her phone. Someone laughed nervously, the half-sound people make when they're not sure if they should be alarmed. "I'm sorry," the man said, and there was something in his voice she couldn't quite read. Not embarrassment, more like concern trying not to show itself too fast. "He doesn't normally—" "He's retired. He's not supposed to be working anymore, but he's been trained for medical detection," Nora said. A pause. "Yeah." She looked at the dog. The dog looked at her stomach. She felt something cold settle in at the base of her throat. "What's his name?" "Ranger." "How long was he working?" 7 years. Navy program. He was attached to a field medicine unit, specialized in detecting physiological stress, internal bleeding, sepsis, blood pressure crashes. They retired him last year." Another pause. "He doesn't false alarm." The cold feeling deepened. "I'm fine," Nora said. The words came out before she'd made a decision about them. "Okay," the man said. He didn't say it like he believed her. Well, she had known since Monday that something was off. The headaches had started Sunday night, not behind her eyes the way tension headaches usually came, but at the back of her skull, a heavy, pressing weight that arrived without warning and sat there. By Tuesday, the vision had done something strange twice. A shimmer at the edge of her left eye, there and gone. The kind of thing you could almost convince yourself you'd imagined. The pressure under her ribs was harder to dismiss. It sat there like a fist, consistent and dull, and moved sometimes when she shifted position. She was a nurse. She knew what the list of symptoms she was not writing down looked like when assembled. She'd been telling herself she would get checked after the shift. She'd been telling herself that for 3 days. The dog sat in front of her and didn't move. "What's your name?" the man said. She considered not answering. "Nora." "Callum Rook," he said, not offering a hand because his left arm wasn't working and his right held Ranger's lead. "I'm sorry about this. He usually doesn't—" "You said that already." "Right." A short exhale. "You want me to move?" "No." She meant, "Don't make a scene." What came out of her was just the word. "No, it's fine." It was not fine. Ranger shifted his weight and leaned slightly forward, one paw moving to place itself closer to her foot. Not touching, just closer. His eyes had not left her. Nora looked at the dog for a long moment. She thought about the readings she'd taken at home. She thought about the weight behind her eyes. She thought about her daughter. She already knew it was a daughter, had known since the 20-week scan, had been quietly rearranging her entire interior life around a person who wasn't yet in the world. And something in her chest made a decision before the rest of her caught up. "I should probably tell someone," she said quietly, more to herself than to Callum. "Probably," he agreed. She looked up, and that was when Dr. Warren Stiles walked past. Warren Stiles was the overnight ER supervisor. He was 46, the kind of physician whose confidence had curdled somewhere along the way into something harder and less flexible. He'd been at Hargrove Memorial for 11 years, and he ran the department, the way men of a certain disposition ran things they'd held too long. with the assumption that his read on any situation was the correct one, and that anyone who disagreed was either incompetent or causing trouble. He did not like Nora Calloway. He'd never said so directly, but the shape of the dislike was clear enough. In the way he reassigned her cases without explanation, in the way he talked over her during briefings, in the way he'd responded to her pregnancy announcement with a long pause and then a discussion about adjusted duties that had nothing to do with her actual capacity and everything to do with his assessment of her usefulness. He was the kind of man who mistook caution for cowardice and size for strength, and he'd decided 8 months ago that a pregnant nurse was a liability waiting to happen. He stopped when he saw Ranger. "What is that animal doing in my waiting room?" "He came in with a patient," the desk clerk said from across the room. "Service animal exemption. The handler's registered." Stiles looked at Callum, then he looked at Nora. His expression shifted into something she'd seen before, the particular set of his jaw that preceded a decision he'd already made. "Calloway." He said her name like it was the wrong answer to a question. "Why are you sitting?" "I finished a patient assessment. I'm charting." "You're sitting in the waiting room." "There wasn't a chair at the station." "I need you on trauma too. Mrs. Alcott needs a secondary evaluation." Nora looked at him. She'd assessed Mrs. Alcott 40 minutes ago. The secondary wasn't due for another hour. "I can do that in now, Calloway." She started to stand. Her body registered the movement with a spike of pressure at the base of her skull, so sharp she stopped halfway and gripped the armrest. Callum was looking at her, not performing concern, just watching with the specific attention of someone calibrating a situation. "You're going to want to get her a chair," he said. His voice was the same tone as before, unhurried, even. But the quality of it had changed slightly. It wasn't a suggestion anymore. Stiles turned to look at him with an expression that said he was not accustomed to being addressed by people in civilian clothes sitting in his waiting room. "Excuse me?" "She needs to sit. I'd get her a chair before she makes the decision for you." A beat of silence. Nora said, "I'm fine." And then her vision did the shimmer thing again. Left side, edge of her eye, just for a second. And she sat back down because her body wasn't asking anymore. Stiles's face had done something complicated. He'd seen her sit down involuntarily. He couldn't pretend he hadn't. But the machinery of his disposition was already running, and rather than let it stop, he recalibrated. "This is exactly the problem," he said, and his voice had dropped into the register he used when he was preparing to be reasonable sounding about something that wasn't. "I've said for weeks that you're trying to carry too much. You're 8 months pregnant, Calloway. I'm not the enemy for saying you should be on reduced duties." "You're not saying that," she said carefully. "You're saying I can't function. I'm saying you're sitting in the waiting room instead of doing your job because you're clearly not well, and I've been warning you about this. Dr. Stiles." Delia Marsh's voice came from the corridor entrance. She was standing at the edge of the alcove with a tablet in her hand and an expression that suggested she'd heard at least the last 90 seconds. "Mrs. Alcott is asking about her discharge paperwork, not her evaluation. I already handled it." Silence. "The secondary evaluation," Stiles said, and the certainty had gone slightly uncertain. "Wasn't due for another hour," Delia said pleasantly. Nora was correct. Stiles looked at Nora. The look said, "This isn't finished." He said, "Take 10 minutes, then I want you on the floor." He walked away. Nora exhaled. Ranger leaned forward and placed his chin very gently on her knee. She didn't take 10 minutes. She took 4 and spent 3 of them in a bathroom, with her back against the tile wall, running through what she knew about her own body and trying to be honest about it. Her blood pressure reading from earlier that day had been elevated, not dramatically, but beyond what it had been 2 weeks ago. The headaches were positional, worse when she lay down. The visual disturbances were new. The epigastric pressure had been present for 5 days. She stood in a hospital bathroom knowing exactly what she was describing and doing the thing people sometimes did when the knowledge was too close. She cataloged it and filed it and told herself she would deal with it after the shift. She went back to the floor. Callum was still in the waiting area when she passed through. He watched her go without saying anything. Ranger turned his head to track her until she moved out of his line of sight. The next 2 hours were the ordinary version of difficult. A pediatric case that needed careful handling. An older patient whose daughter had questions that required patience. Nora was running low on a medication dosage that someone had charted incorrectly and which she caught before it became a problem. Normal work. the kind she'd been doing for over a year here, and before that in circumstances that made this floor feel quiet in comparison. She did not think about those circumstances. She rarely did. At 11:47, Callum Rourke was called back to an exam room. She saw him from across the department. He'd been waiting over 2 hours with his arm held carefully in that same deliberate stillness, and he stood without complaint when the tech called his name. Ranger walked beside him with his whole body oriented toward the man's left side, as if still positioning himself between the injury and the world. Nora was at the nurse's station writing up a patient note when Delia appeared at her elbow. "You should go get checked," Delia said, quietly enough that it was a conversation between the two of them. "I'm fine." "Nora." "I'm fine, Del. I'll go in the morning. I have an appointment Friday anyway." Delia looked at her with the expression of someone who knew a lie when they heard one and had the professional decency to let it stand for 30 more seconds. "The dog made the whole waiting room uncomfortable," she said finally. "He's retired military K9. He's trained for medical detection." "I know what he's trained for, that's why I'm telling you to go get checked." "After my shift." A long pause. "After your shift," Delia agreed in a tone that meant, "I'm logging this in the back of my mind and I will have opinions later." Nora turned back to her screen. The headache was sitting at a 7 now, maybe an 8. She pressed 2 fingers against the base of her skull for a moment where no one could see, then straightened and kept writing. At 12:20, the paramedic radio went off. The sound of it changed the floor the way it always did. A subtle shift in the body language of everyone who heard it, an attention that moved away from what they'd been doing and toward the voice coming through the scanner. Nora heard it from 3 beds away and felt her own attention sharpen in the way it always sharpened when she heard those tones, a reflex older than her time at Hargrove Memorial. "Hargrove, this is Medic 7. Inbound with a 44-year-old male, industrial injury, partial degloving right arm, and significant blood loss at the scene. BP 78/50 and dropping. ETA 4 minutes. The department reorganized without theater. Delia called the trauma bay." Stiles came out of his office. A tech started moving equipment. Nora was already pulling on gloves. "Calloway," Stiles said without looking at her. "Observation, not primary." She stopped. "I'm the most experienced nurse on the floor right now. You're 8 months pregnant. You're not going near an active trauma bay. You have 2 nurses and a first-year tech available for a partial degloving with pressure in the 70s. You need observation or step out entirely." He looked at her then, direct and flat. "Your choice." It was not a choice. They both knew it. She stepped to the edge of the bay and stayed there, gloves on and useless, while they brought the man in and she watched Stiles run the resuscitation with a first-year tech who kept reaching for instruments in the wrong order and a nurse who was competent but hadn't handled a case this degree of blood loss since a training simulation. She watched. She did not speak. She made herself not speak, which was different. The man, heavyset, wearing what remained of a work jacket, unconscious on arrival, had a forearm injury that was exactly what the medics had described, and then some. The bleeding was being managed. The pressure was the problem. Stiles called for blood products and intubation simultaneously, which was the right call, but when he reached for the drug dosage, he pushed 70 milligrams when she would have pushed 50, and she watched the monitor respond with a change in heart rate that made her jaw tighten. The man stabilized, barely, closer than it needed to be. Stiles stepped back and said something to the tech that sounded like praise, and Nora turned away from the bay and stripped her gloves off at the disposal bin with more force than was necessary. The headache hit like a hammer. It wasn't gradual this time. It went from 7 to something she didn't have a scale for in approximately 2 seconds, a white pressure bloom at the back of her skull that made her vision go briefly sideways and her hand shoot out to the counter for support. She stood there for 3 or 4 seconds with her palm flat on the counter and her eyes closed, waiting for it to pass. "Hey." She opened her eyes. Callum Rourke was standing 5 feet away in the corridor outside the bay, Ranger beside him, his left arm now in an actual sling. He'd been discharged. He was holding his paperwork in his right hand and not moving towards the exit. "You okay?" he said. "Yes," she said. He didn't move. "Slight headache. I'm fine." Ranger had already turned toward her. Both of them were watching her with the same quality of attention. Unhurried, direct, not buying a word of it. "You should sit down," Callum said. "I need to—" "I know." You need to get back to the floor, and you've got half a shift left, and there's no one to cover for you. And it's fine. It's fine. You're fine." His voice was still even, but something had entered it. "I've heard that speech. I've given that speech. I know exactly what it sounds like, and I know what it looks like from the outside." He paused. "Sit down." She sat down. She didn't plan to. She found herself on the bench in the corridor with her back against the wall, and Ranger standing in front of her with his nose 4 inches from her knee, and the headache was still there. And her hands were shaking slightly, and she admitted it, quietly, just to herself, in the way you admitted things you'd been not saying for days, frightened. "How long?" Callum said. He'd sat on the other end of the bench, turned slightly toward her, leaving space. "How long what? How long have you been waiting to tell someone?" She looked at him. He looked back. "Few days," she said finally. "How many days is few?" 5. He nodded. Not judgment, just acknowledgement. "What are you running from?" She thought about that. The real answer was complicated and had nothing to do with the pregnancy and everything to do with years of training herself to be the person who handled things rather than the person who needed handling, and she wasn't about to explain that to a stranger on a hallway bench at 12:30 in the morning. "Nothing," she said. "I was going to deal with it after the shift." "Which shift?" She didn't answer. Ranger pressed his nose against her knee, just briefly, then sat back. She was going to go find Delia. That was the decision she'd made. Find Delia, tell her about the headache, let Delia make the next call, which would almost certainly be to pull her from the floor and put her in a bed on the OB unit for monitoring. She'd mentally accepted this. She'd gotten to her feet. She got approximately 12 steps. Warren Stiles came out of the trauma bay, saw her standing in the corridor with Callum, and stopped. His expression processed the scene: off-duty patient, dog, Nora not at a workstation, and whatever he processed made his jaw do the thing. "Calloway, why are you in the corridor?" "I was going to find Delia." "You were talking to a patient." "He's been discharged. I saw what was happening." His voice had found the reasonable tone again, which was always the most dangerous version of him. "I've been watching this all night, and I want to be clear with you. The hospital has policies about staff and patient contact outside of clinical settings. If you're too impaired to be on the floor—" "I'm not impaired," she said. "I have a headache." "You grabbed a counter during a trauma." "I was stabilizing myself." "You're 8 months pregnant with symptoms you won't report. You just had what looked like a syncopal episode in front of a patient." He was building to something. She could hear it in the layering of evidence, the careful construction of a case. "I have an obligation to the hospital and to the patients on this floor to make a determination about fitness for duty. Warren, I'm pulling you from active floor duties until a physician can clear you. You can sit in the charting room or you can go home. Those are your options." The corridor had gone quiet in that particular way that meant people were listening. She felt something hot move through her chest. Not panic, not tears, something older and sharper than either of those. She had felt this particular thing before, in a completely different context, and she had learned what it meant. That someone with authority was using it to reduce her to something manageable. "You don't have the authority to remove me from duty for a headache without going through HR and completing an incident report," she said, and her voice was very controlled. "If you're making a fitness for duty determination, it needs to be documented, which means you'll need to explain why you didn't act on the symptoms you just said you've been watching all night, while I was treating patients, without saying a word until I was standing in a hallway talking to a man with a dog." Stiles's jaw moved. "Go ahead and pull me," she said, "but document it correctly." He stared at her. Then, "You're a nurse, Calloway, not a combat medic, not whatever you were before you came here. A nurse. Start acting like one." He said it deliberately, as if placing each word in a specific position. "Go to the charting room." She went. She didn't run. She walked evenly, and she didn't look back at the corridor, and she didn't look at Callum on the bench, or at Ranger, who she could hear moving even before the noise started. Because Ranger started barking, not at her. She heard the direction wrong at first, heard it, and thought he was reacting to her leaving, to Stiles's voice, to something in the corridor. But as she pushed through the door of the charting room and the sound didn't diminish, she realized the bark wasn't aimed at anything in the hallway. It was coming from somewhere inside the department. She stopped. Behind her, through the door, she heard Callum's voice, sharp now, not even anymore, and she heard Delia say something she couldn't make out, and she heard the scanner on the paramedic radio do something it almost never did at 12:45 on a Friday night. It went silent, and then the lights went out. Not a flicker, not the brief stutter of a power interruption that sometimes preceded a generator handoff. They went out completely. The entire corridor, the nurses' station, the trauma bays, all of it, dark, for one full second. Long enough for someone to scream, long enough for the monitors to go quiet in a way that was not quiet at all, because silence in a trauma bay meant nothing was running. And then the emergency generators kicked on. And instead of stabilizing the floor, the overhead intercom crackled to life with a sound she recognized before the voice finished the first syllable. Mass casualty alert. The words hit the department like a pressure wave. An industrial explosion, the voice said. A fertilizer storage facility on the east side of the port. Early reports put it at multiple victims, fire still active, first wave of casualties inbound in under 8 minutes. 8 minutes. Nora stood in the doorway of the charting room with the emergency lights throwing everything red and orange, and she heard the department reorganize around her. Not smoothly, not the way a well-drilled team snapped into formation, but with the jagged, fractured quality of people working from crisis rather than preparation. She heard Stiles' voice rising above the others, heard him assign the trauma bays in an order that was wrong, that prioritized the bays that had lost monitor function in the blackout over the ones that still had power, and she stood there for 2 full seconds doing something she almost never did. She stood still. Ranger's bark had stopped. In the silence before the first ambulances arrived, she heard Callum's voice again, from somewhere behind her now, closer than she'd expected. Very quiet, not meant for anyone but her. "You've done this before," he said. Not a question. She turned. He was standing at the edge of the corridor, sling still on, Ranger beside him, watching the department through the window in the charting room door with an expression she recognized because she'd seen it on other people and had likely worn it herself at various points in her life. The expression of someone who'd just watched a situation outgrow the people managing it. She looked at him for a moment. Then she looked through the window at the department. The wrong bay assignment. The tech still in the wrong position. The monitors that needed rerouting. The first stretcher already visible through the external doors. Lights strobing in the parking lot. 2 more units turning in from the road. 8 minutes had become 3. "More times than I ever wanted to," she said. She pushed through the door. She pushed through the door, and the department came at her all at once. Noise, heat, the chemical smell of emergency lighting, the sound of someone shouting orders that didn't match the situation. She didn't stop moving. The first thing she fixed was the bay assignment. Stiles had routed incoming casualties to Trauma 1 and Trauma 3, both of which had lost primary monitor function when the blackout hit. The generators had restored partial power to the floor, but the rerouting hadn't completed. The monitors in those bays were showing partial data at best, error codes at worst, and nobody had caught it yet because the room was loud and everyone was looking at the doors. Nora moved to the nurses' station, pulled up the power distribution panel on the backup terminal, and rerouted the primary trauma feeds to Bay 2 and Bay 4 in 45 seconds. She knew this building. She'd worked this floor for over a year, and she'd spent 3 weeks after orientation memorizing the generator failover sequence, because that was the kind of thing she'd always done. Learned the mechanics of a place the way other people learned the social dynamics. Because knowing where the power went in an emergency was more useful than knowing whose coffee order was whose. "Bay 2 and 4, she said to the nearest tech, a young woman named Priya who was standing with a stack of supply trays in no clear direction. "Get your crash carts there. Both bays. Go." Priya went. "Calloway." Stiles' voice came from behind her, sharp and high. "What are you doing?" "Bays 1 and 3 are on partial monitor function. I rerouted. I know what you assigned. 1 and 3 are running on error display. You'll have no reliable vitals on any patient you put in there for at least another 6 minutes until the system finishes cycling." She turned to face him. "You want to argue about it now, or do you want to be ready when the first unit pulls in?" He looked at the monitor display. He saw the error codes. His face did the calculation. He didn't answer her. He turned and began moving toward Bay 2, and she took that as the only answer she was going to get. The external doors opened, and the department changed shape. The first stretcher came through fast. A man in his 50s with blast injury to his lower extremities, both legs wrapped in field dressings that were already saturated, BP 66/40 on arrival. Behind him, almost immediately, a second unit backed in with two more, a woman with facial trauma and what the medic called a possible orbital fracture, and a younger man who was conscious and screaming about his arm in a way that suggested the arm was the least of his problems. 3 patients, 90 seconds. The radio said 4 more units inbound. The department had capacity for a mass casualty event on paper. In practice, at 12:50 on a Friday night with reduced overnight staff and 2 bays recently rerouted, capacity was a number they were already approaching. Nora took the first patient, not because anyone assigned him to her, because she was closest to Bay 2 when they wheeled him in, and because she could see in the first 3 seconds what the medic's report had outlined and what it had missed. The blast injury to the legs was significant, yes, but the patient was also showing the specific look of someone bleeding from somewhere the dressings weren't covering. His abdomen was rigid under her hands when she pressed. "Internal," she said to the attending who'd arrived at the bay, a physician named Dr. Sandra Okafor, who was young, 2 years out of residency, and terrified in the competent way of someone who'd never run a mass casualty event, but who was tracking everything fast. "He's got internal involvement. The legs are the visual distraction. Get CT authorization and a surgery consult now, not after you've managed the extremity bleeding." Okafor looked at her. Then she looked at the patient. Then she made the call. Nora moved. The department was fragmenting, not collapsing, but developing the kind of fracture lines that mass casualty situations created, where individual good intentions started pulling in directions that didn't align, and the gaps between efforts became the places patients fell through. She could see it happening the way she'd learned to see it. The tech in the corner who'd been assigned to Bay 3, but whose patient had just been moved to Bay 4 without anyone telling him. The crash cart that had been positioned at the wrong angle for the bay configuration and would create a traffic problem in approximately 90 seconds when the next stretcher came through. The medication tray that someone had pulled from storage and left on a surface that was about to become the primary work surface for the facial trauma patient. She moved the cart. She flagged the tech. She relocated the tray. None of it was glamorous. All of it mattered. She was at the secondary supply station pulling a second IV kit when she heard Stiles' voice escalate. She couldn't make out the words at first. The department was loud. The intercom was cycling through announcements. Someone's monitor was alarming. But the tone was distinct. High, pressed, the sound of a man who'd misplaced his authority and was trying to find it. She moved toward the sound and found Stiles standing at the entrance to Bay 4 with a chart in his hand and an expression she hadn't seen on him before. Not arrogance. Something smaller than that, and more dangerous. Panic wearing the mask of command. The patient in Bay 4 was the younger man who'd been screaming about his arm on arrival. He'd been sedated enough to stop screaming, but the arm was the distraction Nora had suspected. A significant laceration, painful, bleeding, real. And what Stiles was holding was the chart that someone had started before the Bay reassignment, which meant the medication log was attached to a patient identifier from Bay 3, and the dosage notations were written for the wrong weight. She saw it in 2 seconds. "That chart," she said. Stiles looked at her. "I'm handling it." "The weight on the dosage calculation is from the intake sheet in Bay 3. That's not his chart." A pause. "I'm aware of, what's his actual weight?" Stiles looked at the chart again. She watched him look at it, and she watched his face do the thing she'd seen it do in the corridor earlier. The recalibration, the quiet replacement of one story with another. And she knew in that moment that he hadn't caught it. He'd been about to push a medication dose calculated for a man 40 pounds heavier than the one in the bed. "I need his intake weight from the medic's report," she said. She didn't make it into an accusation. She made it into the next step. "Priya, what's the field weight from Medic 7's run sheet?" Priya appeared from around the partition with a tablet. 81 kilos. Stiles' chart said 118. The silence between those two numbers lasted approximately 1 second. "Recalculate," Nora said quietly, still not making it into anything except the next step. "I'll draw the corrected dose." Stiles handed her the chart. She didn't look at his face when she took it. The 4th and 5th patients arrived together at 1:14 in the morning, and the 6th came alone 4 minutes after that, and by 1:30 the department had processed 8 casualties from the port explosion with 2 more units still inbound. The fire at the fertilizer facility was still active. She could smell it faintly when someone opened the external doors, a chemical burn smell that was different from wood fire, sharper, with an acrid undercoat that made the back of her throat tighten. She'd stopped noticing her headache somewhere around the fourth patient. That happened sometimes, the body's priority system overriding whatever it had been managing when something more urgent arrived. She knew the headache hadn't gone away. She knew it was sitting there waiting for the moment her focus dropped. She kept her focus up and didn't give it the moment. Callum Rourke was still in the building. She'd noticed him twice without meaning to. Once near the secondary entrance where he'd positioned himself against the wall, out of the way of the traffic, watching the department with the particular quality of someone assessing rather than observing. Ranger sat beside him, steady and quiet. Now, the earlier alertness settled into something watchful rather than active. The second time she noticed Callum, he was in quiet conversation with one of the security staff. She couldn't hear the words, but the security guard had straightened slightly, in the way people straightened when they were recalibrating how seriously to take someone. She didn't have time to think about what that meant. At 1:42, she found the error in room 6. The patient in room 6 was a man named, she checked the intake sheet, Harlan Voss, 58 years old, brought in during the initial wave with what had been documented as a contusion to the chest wall and a possible rib fracture. He'd been stabilized, assessed by a first-year resident, and moved to a monitored room while the department focused on the more acute arrivals. The resident's notes said his pressure was holding. His chart said he'd been given a standard analgesic for the rib pain. Nora went into room 6 because the room's monitor had been alarming intermittently for 12 minutes and nobody had gone in. The man in the bed was gray. Not metaphorically. His skin had taken on the specific ash-gray color that she'd learned to recognize before she'd learned most of the other things she knew. In conditions where learning to recognize it fast was the difference between one outcome and another. His breathing was shallow and quick, the kind that looked like it was working hard to look normal. His pressure on the monitor read 94/62, which was not alarming in isolation, but when she looked at the original intake notation, 138/82. The drop was 22 minutes old and continuing. She pressed her hands to his abdomen. He winced and cried out, which was notable because the chart said he'd been given pain management 30 minutes ago. She looked at his chest. She looked at the original intake notes. She looked at the physician's notation, which said chest wall contusion, and signed off on the analgesic and the monitoring order. The resident had missed it, or hadn't had time to look closer, or had looked and decided the visual evidence was sufficient. Any of these were possible. She didn't know which one it was, and it didn't matter right now. What mattered was that Harlan Voss had a chest wall injury that was not a contusion, and his pressure was dropping, and he had been in this room for over an hour. She hit the call button. Then she went to the door and raised her voice in the way she had learned to raise it. Not a scream, not a request, something between the two that carried across a noisy floor and made people look. "I need a physician in room 6, now." Okafor came. She was the one Nora trusted to read what she was looking at and to read it fast. "Possible hemothorax," Nora said as Okafor moved past her to the patient. "Intake noted contusion only. Pressures dropped 36 points in 22 minutes. Pain management isn't holding. Abdomen's reacting." Okafor was already at the bedside, hands moving. 30 seconds of assessment. Her face changed. "Get me a chest tray," she said, "and get surgery on the phone. Not the consult line, the direct line." Nora got her the chest tray. She was at the supply station pulling the kit when she heard the voice behind her. Not Stiles this time, lower and more controlled than Stiles had been all night. She turned. The man standing in the doorway of the supply station was not a Hargrove Memorial employee. She knew everyone in this department, and she did not know this man. He was in his 50s, with the posture and the kind of face that didn't arrange itself into readable expressions without a reason. He wore a dark jacket, no hospital badge, and he was looking at her with an attention she recognized. "You're Nurse Calloway?" he said. "Who are you?" "My name is Alderman. I'm with the Naval Criminal Investigative Service, Pacific Division." He said it the way people said things they said regularly, without inflection. "The patient in room 6, Harlan Voss. I need to know his current status." Something moved in her chest that wasn't quite alarm and wasn't quite recognition. "He's being treated. That's all I can tell you." "He was at the facility when it detonated. He's not a dock worker." Alderman paused a single beat. He's a civilian systems contractor with a current federal clearance. We've been looking for him since the explosion was called in. She looked at him. His status, Alderman said again. Serious, but being addressed, she said. You need to talk to hospital administration. Patient information is not something I understand. I've already spoken with your administrator. I'm also going to need the names of the physicians who assessed him on arrival. He looked at the chart in her hands. She hadn't realized she was still holding it. And whoever signed off on that chart. She looked at the chart, at the signature at the bottom of the intake assessment and the monitoring order. The name at the bottom was not the first-year resident's name. It was Warren Stiles. She stood in the supply station for a moment that was probably 3 seconds and felt like considerably longer. Stiles had signed the Room 6 assessment, not the resident. The notation was in the resident's handwriting. She could tell from the lettering, had seen it enough times in the past 4 hours to recognize it. But the signature at the bottom was Stiles's, which meant he'd reviewed the assessment and signed off on it, which meant the monitoring order was his, which meant the decision to categorize Harlan Voss as a stable chest wall contusion and move him to a monitored room and not look further. That decision had Stiles's name on it. The resident had done the initial workup. Stiles had the authority to review it. Stiles had reviewed it, signed it, and moved on. And now Harlan Voss was in room 6 with a dropping pressure and a chest that was filling with blood. She gave Alderman the chart. She didn't make a decision about it. She handed it to him the way you handed something to someone who had just told you it was the thing they needed, because she was still inside the speed of the evening and the decision-making part of her brain was operating on the same system it had been running all night. Triage, priority, next step. She went back to room 6. Okafor had already begun the chest decompression procedure. The patient was more conscious than he'd been when Nora first came in. That was either a good sign or the specific bad sign she didn't want it to be, and she watched his pressure on the monitor while Okafor worked, and she breathed through her nose and kept her hands busy with the equipment and did not let herself calculate the time between his arrival and right now. The pressure stopped dropping at 157. It held at 91/58, which was not good but was not the continued decline that would have ended this in a different way. Okafor exhaled. It was a small sound, controlled, and she immediately picked up where she'd left off, but Nora had heard it and knew what it was. Nice catch, Okafor said, without looking up. Nora didn't say anything. In the corridor outside room 6, she could see Alderman on a phone, speaking quietly and looking at the chart she'd given him. She could see 2 other men near the external entrance who hadn't been there 20 minutes ago, both in dark jackets, both with the posture that matched Alderman's, both with eyes that were doing the same thing Callum's had been doing all night, recording. And then Callum himself appeared in her peripheral vision, moving from the secondary entrance toward the corridor, Ranger walking at his side. He stopped when he saw the men near the entrance. She watched his face from 30 feet away, watched the recognition move through it, brief and controlled, the way recognition moved through people who knew how to not let things show. He looked at her. She looked back. He walked to her and stopped 2 feet away, his voice low. Who's the man with the chart? NCIS. The patient in room 6 is apparently a federal contractor. Callum absorbed this in approximately 1 second. What's Stiles' connection to the chart? She hadn't told him about the chart. She hadn't told anyone except Alderman. How do you... I was standing outside the supply station. He said it simply, without apology. The wall doesn't go to the ceiling. She looked at him. It's his signature on the assessment. He reviewed it and signed off. And the patient was missed. The patient was missed. Callum looked down the corridor at Alderman, then at the other men near the entrance. He was doing something with that information that she couldn't entirely read, and she had a sense of something preparing to happen. Not quite the feeling of an action already in motion, but the feeling of one about to begin. Stiles is going to know, she said. When Alderman goes looking for him, he already knows something's happening. Look at him. She looked. Stiles was at the nurse's station at the far end of the corridor. He had his back to room 6, but his shoulders were wrong, too high, too deliberate, the body language of a man trying to look busy who was actually listening to everything around him. He'd seen Alderman. He'd seen the men at the entrance. She didn't know if he'd seen her give Alderman the chart. His phone was in his hand. He was texting. He's going to try to get ahead of it, she said quietly. What does he have to get ahead of? She thought about the dosage error. She thought about the chart. She thought about the medication log with the wrong weight. She thought about the monitoring order in room 6, signed and set aside while Harlan Voss sat in a room with a hemothorax for over an hour. More than one thing, she said. Ranger made a sound she hadn't heard from him before. Not a bark, not a whine, something lower and quieter than either. The kind of sound that wasn't communicating distress, but was communicating attention. He turned toward the far end of the corridor where Stiles was standing with his phone, and his ears were forward in the way they went forward when he was working. He does that when he senses deception, Callum said. He said it in the same tone he said everything, flat, without drama. She would have laughed if the night had been different. At 2:17, Warren Stiles walked into the administrator on call's office with a prepared statement. She knew this because Delia told her, pulling her aside at the nurse's station with a face that was doing the careful, neutral expression of someone who had processed something unexpected and was waiting to see what she made of it. He went in about 10 minutes ago, Delia said, voice low. I don't know what he said, but he came out with a printout and he's been on his phone. Did he look worried? He looked like he was deciding what to be worried about. Delia paused. 2 federal agents showed up about 5 minutes after he went in. Administrator sent them to wait. Nora looked toward the administrator's corridor. She couldn't see anything from where she stood. The patient in room 6, Delia said. He's being handled. Okafor's managing. Okafor told me Stiles signed that assessment. Yes. Delia looked at her, a long look, the kind that meant she was measuring something. How long have you known that Stiles' documentation has been the problem? Nora thought about the dosage error. She thought about earlier in the night and the week before that, and the specific ways she'd been watching Stiles navigate the department, and the specific things she'd noticed that she'd filed and not said because saying them required her to be the kind of visible she'd been trying not to be. Tonight specifically, she said. Other things? Longer. Delia nodded once, slowly, as if she'd expected that answer. I'm going to write my own incident report. Dell, I've been watching that man for 11 years. I have a responsibility. She met Nora's eyes, direct and level. And you need to sit down. Don't argue with me. Nora's headache agreed. She sat at the nurse's station rather than the waiting room, near enough to the monitors to still be useful, and she pressed her fingers against the base of her skull for a moment where nobody was watching, and she let herself feel the weight of the evening. Not the crisis management, not the triage decisions, not the chart in Stiles' handwriting, or the gray face of Harlan Voss, but the particular weariness of being right and being dismissed, and then being right in a way that couldn't be dismissed anymore. It wasn't satisfaction. It was too exhausted to be satisfaction. She felt her daughter move, a slow, rolling shift, the kind of movement that felt more like a stretch than a kick, and she put one hand flat against her side and sat there for a moment with the department reorganizing itself around her, and the emergency lighting still casting everything in that reddish-orange that made the familiar floor look strange. Callum had found a chair near the secondary entrance. Ranger was asleep, actually asleep, his chin on his paws, the alertness finally banked for the night. She could see Callum from where she sat. He wasn't looking at her. He was watching the administrator's corridor with the same patient attention he'd been giving everything all night. She'd been looking at him for maybe 15 seconds when he looked at her. He didn't say anything. Neither did she. He gave her a single small nod. Not reassurance, not encouragement, just acknowledgement. The kind that meant, I see you still here. She turned back to the monitors. At 2:48, the administrator's office door opened. What came through it was not what she'd been waiting for. She'd been expecting Stiles, with a statement, with a defense, with the particular brand of controlled spin that men like him deployed when they felt the ground shifting. Instead, the first person through the door was Alderman, and the second person was someone Nora didn't recognize. A woman in her 40s in a navy dress uniform, the kind of uniform that people wore when the occasion required it, with a rank designation that Nora knew enough to read even from the distance of the nurse's station. Commander. Alderman said something to the woman, too low to hear, and the woman nodded without looking surprised. Nodded the way people nodded when they'd been briefed and were now operating on the briefing. She looked at the department with a single comprehensive sweep. And then she looked at the nurse's station. She looked at Nora. And she said something to Alderman, and Alderman looked at Nora, and Nora felt something shift in the room that she didn't yet have language for. Not threat, not rescue, something in between, the particular feeling of a larger machinery beginning to move in a direction she hadn't anticipated. Stiles came through the door behind them. He was holding his printed statement, and his face had lost whatever it had been managing earlier. He looked smaller than he had at the start of the shift, and somehow the room's emergency lighting made that more visible. The shadows falling differently on a man who'd been holding a shape and had stopped holding it. His eyes found Nora. Across the length of the department, across the nurses' station and the monitor banks and the residual organized chaos of a floor that was beginning to settle after the night it had been through, he looked at her. She looked back. Callum stood up from his chair near the secondary entrance. Ranger came to his feet beside him. Not urgent, not alarmed, just ready, the way a working animal came to its feet when the work was resuming. Both of them were looking at the three people moving from the administrator's corridor into the department. And Warren Stiles looked at the Navy commander. At Alderman. At the chart that Alderman was carrying in a clear document sleeve that meant it had already been treated as evidence. He looked at his printed statement. He looked at the chart. He looked at Nora. And she watched something happen in his face that was not guilt. Guilt would have been simpler than this, but was something closer to the specific recognition of a man who had understood, perhaps for the first time all night, that the calculations he'd been making were built on a foundation he'd misread entirely. That the woman he'd pulled from the trauma floor and mocked and told to sit in the charting room was not the variable he'd thought she was. The commander had reached the nurses' station. "I'm looking for a nurse named Calloway," she said. "That's me," Nora said. The commander looked at her, at the swollen hands, at the exhausted face, at the scrubs and the clipboard and the monitor screen still showing the status of patients Nora had managed through the night. She looked at all of it with the comprehensive attention of someone conducting a fast assessment. Then she looked at Stiles. "Commander Harrington, Navy Medical Command Pacific," she said to the room rather than to any one person. "I'm here about Harlan Voss, and I'm going to need to speak with whoever signed his admission chart." She paused. "Tonight." The printed statement in Stiles' hand shook slightly, just once. The printed statement dropped. Not dramatically. Stiles didn't drop it the way someone drops something in a movie, with gesture and implication. It just fell from his hand and landed on the floor of the corridor, face up, and nobody moved to pick it up. The department had gone quiet in the specific way it went quiet when the ambient noise of crisis receded, and what remained was the sound of something else beginning. Commander Harrington hadn't looked away from Stiles. "Dr. Stiles," Alderman said, as if completing a sentence that had been started elsewhere. "We've been through the intake documentation. We have some questions about the assessment timeline for Mr. Voss." "I reviewed the resident's assessment," Stiles said. His voice was careful in the way of someone who had prepared a version of events and was now deciding how much of it still applied. "I signed off based on the information available at the time." "The information available at the time indicated a possible hemothorax," Harrington said. "There's a notation in the resident's handwriting on the preliminary assessment. 3 lines, circled. The word possible with a question mark." She looked at Stiles without inflection. "Your signature is 4 lines below it. The monitoring order is below that." Silence. "I made a judgment call," Stiles said. "You made a judgment call," Harrington repeated, not as a question. Nora was watching from the nurses' station. She had both hands flat on the counter in front of her. She was very still. "The notation was speculative," Stiles said. "The resident flagged a possibility. I reviewed the clinical picture and determined monitoring was appropriate pending further developments." "Mr. Voss was in that room for 67 minutes, Alderman said, "during which time his pressure dropped 38 points. He's in surgery now because of a hemothorax that was annotated as a possibility in his initial chart." He held up the document sleeve with the chart inside it. "A chart you signed." Stiles looked at the chart. Then he looked at Nora, and the look was not the controlled professional recalibration she'd seen from him all night. It was faster and rawer than that. The look of someone searching for the source of a leak and finding it. "She gave you that chart," he said. "A member of your nursing staff identified a patient in distress," Harrington said, and her voice had found the register that commanders found when they were done with the preliminary stage. "That patient was a federal contractor with an active clearance working on a classified infrastructure project at the port facility. His identification was delayed by the chaos of the evening. The clinical outcome of that delay is now a matter of federal interest. She paused. So is everything that was signed in this department tonight? Stiles opened his mouth. Don't, Harrington said. Not loud, just final. Get your union representative. Don't say anything else to anyone in this building without them present. The statement on the floor stayed where it was. Nora didn't watch what happened next with Stiles. There was a part of her that wanted to, the part that had been swallowing this man's contempt for 14 months, that had filed away every dismissal and every public correction and every slow erosion of her professional standing with the patience of someone who'd learned that patience was the only thing that kept you functional in an environment you couldn't immediately change. That part wanted to watch. She turned back to the monitors instead. Harlan Voss was in surgery. His pressure had stabilized in the OR before the chest was opened, which was the best version of a bad situation. Okafor had done the decompression correctly, bought him the time he needed, and the surgical team was handling the rest. Nora had checked twice. She was going to check again in 20 minutes. The other mass casualty patients were distributed across the floor in various states of stabilization. The man with the blast injury to his legs, whose internal involvement she'd caught on arrival, had come out of an abbreviated CT with confirmation of a splenic laceration that surgery was now managing. He was stable. The facial trauma patient had a confirmed orbital fracture and was waiting for an ophthalmology consult that wouldn't come until morning. The younger man who'd been screaming about his arm had a significant forearm laceration and a traumatic wrist fracture, both of which had been addressed, and was currently medicated into a sleep that looked more peaceful than anything else in the building. 8 patients in, 8 patients with someone actively watching them. She let herself breathe for 30 seconds. Her headache was back. Not the background noise version, the real version, the pressing, weighted thing at the base of her skull that had been escalating all week, and which she had been managing through the night on nothing but stubbornness and adrenaline. The adrenaline was metabolizing. The stubbornness was still there, but it was tired. She was aware that her blood pressure had probably not improved over the course of the last several hours. Nurse Calloway. She turned. Harrington was standing 2 feet behind her. Up close, the commander had a face that was harder to read than it had been from a distance. Not cold, but measured, with the quality of someone who had learned to hold expressions in reserve because expressions communicated before words could. "How are you doing?" Harrington said. It was not a pleasantry. The question had a clinical directness to it. "I'm functional," Nora said. Then, because this woman would see through the version she gave everyone else, "I have a headache. I've been managing for several days. I'm going to get checked after this shift." "You're 32 weeks." "Yes." Harrington looked at her for a moment, not assessing the way Stiles had assessed, not looking for liability or limitation. Something else. "What was your MOS?" she asked. It was a military occupational specialty question. It assumed something that Nora's Hargrove Memorial personnel file didn't contain. "I wasn't Army," Nora said. "Navy Expeditionary Medical. I was a hospital corpsman attached to a forward surgical element." She paused. "I separated 4 years ago." "What rate?" "HM2 at separation. I was in for 6 years." Harrington absorbed this the way she absorbed everything, without visible reaction, without signaling what she was doing with the information. "The way you ran this department tonight," she said. "The rerouting, the triage sequence, the catch in room 6. That's not nursing school." "No," Nora said. "It's not." "Why isn't any of that in your file here?" Nora looked at her. The question deserved an honest answer, and the honest answer was one she hadn't said out loud to anyone in Port Carver. "Because I was trying to be a civilian," she said. "I was trying to be just a nurse. I thought it would be easier." She stopped. It wasn't easier. It just meant that nobody knew what they had. Harrington looked at her for another beat. Then she said, "We're going to need a full statement from you about tonight. Not just the chart, the whole shift. What you observed, what you corrected, in what sequence." She paused. "I want you to know that statement is going to be part of a federal review of this facility's conduct during a mass casualty event involving a government contractor. I understand. I also want you to know," and here Harrington's voice did something small and human that it hadn't done before, a shift of maybe 2 degrees towards something less formal, "that the man in room 6 has a wife and 2 kids, and he's going to make it, Because of what you caught. Nora looked at the floor for a moment, then back up. I was doing my job. You were doing considerably more than your job, Harrington said, and you were doing it after someone had tried to send you to the charting room to sit down. She walked back toward Alderman and the other agents without waiting for a response. Delia appeared at Nora's elbow with a cup of water and the expression of someone who had made peace with the fact that the night was going to keep happening for a while yet. Drink this, Delia said. Nora drank it. Your hands are still swollen, Delia said. I know. Your BP this morning was 152/94 when I took it at the start of shift. Nora looked at her. You took it? You left your cuff on the counter when you went to assess Mrs. Alcott. I took it while you weren't looking. Delia met her eyes without apology. I should have pulled you then. I didn't, because I know how you are about it, and because this floor needed you tonight and I made a call I'm not entirely comfortable with. So we're going to talk about that. Not right now. No, Delia agreed. Not right now, but the conversation is coming. She looked toward the corridor where Harrington and Alderman were still working. What's happening with Stiles? I don't know exactly. Federal review, I think. The patient in room 6 is connected to a government program. So Stiles signed a chart that effectively delayed treatment for a federal contractor during a mass casualty event. Among other things, Delia was quiet for a moment. He's been falsifying documentation for a while, she said. I've had suspicions. Nothing I could point to directly. He's careful about it, careful about what he puts his name on. But tonight was sloppy. Too much happening too fast for him to manage it the way he usually does. Nora looked at her. You've suspected for how long? 2 years, maybe. Delia's face did something complicated. I know. I know what you're going to say. I'm not going to say anything. You're thinking it. Nora looked away. She was thinking it. But Delia had 22 years in this building, and the knowledge of what happened to nurses who made formal accusations against department supervisors without ironclad documentation, and Nora had no standing to judge the calculation she'd made. I'm writing my incident report tonight, Delia said. Everything I know. Everything I've seen. 2 years of it. She said it quietly and without drama, the way people made decisions they'd been moving toward for a long time without realizing it. It's past time. Nora put a hand briefly on Delia's arm. It was all she had. At 3:20 in the morning, Callum found her at the secondary supply station where she'd gone to restock a cart that didn't need restocking because her hands needed something to do and the supply station was quiet. He didn't say anything for a moment, just stood in the doorway with Ranger beside him, letting the silence settle. How are you doing? He said finally. Same question Harrington had asked, but with a different architecture to it. I've been better, she said. It was more honest than anything she'd said all night. Yeah. He leaned against the doorframe. His left arm was bothering him. She could see it in the set of his shoulder, the way he was distributing his weight away from it. He'd been in this building for over 4 hours and hadn't said a word about his own injury since the sling went on. You should know that Harrington is going to want your service record. She paused with her hands on a supply tray. How do you know Harrington? I don't know her specifically. I know her command. He paused. I was attached to a SEAL medical support element out of Bremerton for 3 years. We ran joint operations with NCIS twice. The structure of how they work, this is standard for them. When a federal contractor is involved in an incident, they pull everyone's history. Yours is going to come up. She thought about that. My record is clean, she said. I separated clean. No incidents, no disciplinary. That's not what I mean. He watched her. I mean your deployment record, your commendations, the things that aren't in the civilian file you submitted to this hospital. She set down the supply tray. There was a convoy operation, she said. It came out simply, the way things came out when you'd been not saying them for long enough that the act of saying them lost its weight. Eastern Sector. 3 vehicles, IED contact, secondary ambush, 7 wounded personnel. We were 40 minutes from the nearest aid station, and the evacuation helo was delayed by weather. He was very still. I was the only medical personnel on the convoy, she said. I held 7 casualties for 52 minutes in a vehicle that was partially on fire. 4 critical, 3 stable but worsening. I lost 1. She said it the way she'd learned to say it, not without weight, because it never lost its weight, but without the pause before it that turned it into a performance of grief. The other 6 made it. After it was over, they gave me a commendation, and I decided I was done. How long after? 7 months. I finished my contract and I got out and I moved to Oregon and I got a nursing job at a regional hospital, and I did not put any of it on my application. Callum nodded slowly. Because you were trying to be invisible. Because I was tired, she said. There's a difference. He thought about that. Is there? She looked at him. He looked back without flinching, which she appreciated. It was the kind of thing that required a certain kind of honesty to do, to ask a question and then stay in it. Maybe not, she said finally. Ranger had placed himself beside her without her noticing. She looked down and found him there, his shoulder warm against her leg, his chin slightly lifted, watching her face with the patient attention of an animal that understood something about waiting with people in hard places. She put her hand on his head. He was very still and let her. The conversation she hadn't been expecting happened at 4:05 in the morning. She was at the nurse's station when Alderman came to her with a tablet and asked her to look at something. The something was a scanned personnel file, her own, pulled from a database she hadn't submitted to Hargrove Memorial because she hadn't submitted her military service record to Hargrove Memorial. The document was complete. 6 years of service, deployment history, training certifications, the commendation from the convoy operation, complete with the citation that described what she'd done in terms that sounded, on paper, considerably more composed than anything she remembered about the actual night. Navy Medical Command keeps active records on all former medical personnel with operational experience, Alderman said. Standard practice. When Harrington ran your name, this came up. Nora looked at the document. She hadn't seen it in 4 years. We also pulled Stiles' record, Alderman said, specifically his record at his previous facility, Meridian Coast Hospital in Astoria. He was there for 6 years before Hargrove Memorial. She looked up. 3 incident reports in 4 years, Alderman said, all filed by nursing staff, all attributed to documentation irregularities and a pattern of, and I'm quoting the internal review, selective oversight during high-volume periods. 2 were formally investigated. Both investigations were closed without finding. He transferred to Hargrove Memorial 14 months ago. 14 months. 1 month before Nora was hired. He knew, she said. It wasn't a question exactly, but she needed to hear it. He knew his record from Astoria was going to come up eventually if something went wrong here, and he was building a documentation pattern that created a buffer, something to point to. We're still establishing that, Alderman said carefully, but the pattern of what happened tonight, the documentation tonight specifically, is consistent with a supervisor who was more focused on managing his own liability than on managing his department. He paused. Your name comes up in 2 of the Meridian incident reports. She stared at him. I've never worked at Meridian. No, but 3 of the nursing staff who filed those reports are women with military medical backgrounds. The documentation issues they cited were similar. Medication charting errors, monitoring orders that were signed but not followed up, a pattern of directing experienced staff to observation roles during high-volume situations. He looked at her steadily. You weren't at Meridian, but you fit the pattern of who he moves out of the way. The headache pressed at the base of her skull. She understood what he was telling her, and she needed a moment to let it land properly, because what he was telling her was not a small thing. What he was describing was not a supervisor who happened to be dismissive of pregnant nurses. What he was describing was a man who had a system, who identified experienced staff, who might recognize his errors, and who spent the time before the errors occurred building the institutional architecture to discredit them, who had spent the last 14 months building it around her. She thought about the day she'd started, the welcome conversation that had been 20 minutes about adjusted duties, the early shift reassignments, the briefings she'd been talked over in, the chart corrections she'd made that had never been acknowledged, the specific accumulation of small dismissals that she'd filed as the ordinary texture of being a woman in a medical hierarchy that was skeptical of her. Some of it had been that. Some of it had been calculated. She couldn't separate them now, and maybe she never would be able to, and that was its own particular kind of damage. What happens next? She said. Tonight, Stiles has been administratively suspended pending investigation. His access to patient records has been revoked. We have a federal hold on everything he signed. Alderman's voice was measured, precise. The hospital's chief of medicine has been notified and is on his way in. The board will be notified at a reasonable hour. A pause. You'll be asked to provide a formal statement. We'll need it in the next 48 hours. Okay, she said. One more thing, Alderman said. He looked at her with the closest thing to an expression she'd seen on his face all night. The notation that the resident made on Voss's chart, the circled possible with the question mark. The resident's name is on the preliminary assessment, but she's a first year. Stiles reviewed that notation, signed the chart, and moved on. He paused. She's been in the break room for the last hour, Nurse Calloway. She thinks she missed it. She doesn't know yet that Stiles signed off after her. Nora looked at him. I thought you'd want to know, he said. She was already moving. The resident's name was Dr. Felicity Tan, and she was 27 years old, and she was sitting on the break room couch with her shoes off and a cup of cold coffee in her hands, staring at the middle distance with the face of someone replaying a loop they couldn't stop. Nora came in and sat beside her, not across from her, not in the chair that would have been the official positioning of a senior staff member addressing a junior one. She sat on the couch. You flagged it, Nora said. Tan looked at her. Her eyes were red, but she hadn't been crying. She had the dry, over-focused look of someone who was running entirely on cortisol. I circled it, Tan said. I wrote possible with a question mark. I should have pushed. You flagged it, and you put it in the chart, and you did what the system requires you to do when you have a concern, and you're a first year, and the supervisor has final authority, Nora said. You did your job. He was in that room for an hour. That's not on you. I flagged it, and then I moved on because there were 6 other patients coming in and Stiles had signed. She stopped. I moved on because someone senior told me it was handled. Because someone senior told you it was handled, Nora said. And it wasn't. That's not the same thing as missing it. Tan looked at her for a long moment. The look had something in it that Nora recognized. Not quite belief yet, but the beginning of it. The place where the worst version of a night starts to admit another interpretation. Alderman is going to want your statement too, Nora said. Tell them everything. Tell them what you saw, what you wrote, and what Dr. Stiles said when he reviewed the chart. Tan's hands tightened around the coffee cup. He told me the monitoring order was sufficient. I used those words. The monitoring order is sufficient. I remember because I wrote it down. Nora looked at her. You wrote it down. I keep a personal log. Tan said it slightly defensively, as if expecting to be told it was an overreach. I've kept one since my second week. I wanted to document my reasoning, in case I made mistakes. I wanted to know why I made them. Give Alderman your log, Nora said. The defensiveness left Tan's face, replaced by something quieter. He's going to come after me, Tan said. Stiles, when this goes to review, he's been administratively suspended. His access is revoked. Nora paused. And he's going to have considerably larger problems than a first-year resident's incident report. Tan absorbed this slowly. Go give your statement, Nora said, and then go home. You're not on until tomorrow night. Sleep. Tan nodded. She put her shoes back on. She moved toward the door, then stopped. Nurse Calloway, she said, I heard what you did tonight, with the triage, and with room 6, and with the... She stopped herself. I wanted you to know that I noticed. Nora looked at her. The tiredness was very close to the surface now, and the headache was pressing, and something in her chest had gone soft in a way she hadn't planned for. Thank you, she said. Now go. Tan went. At 4:40 in the morning, Nora was standing at the window at the end of the secondary corridor, the one that looked out over the parking lot and the access road, and beyond that, the first gray suggestion of the water. The sky to the east had started doing the thing it did an hour before real dawn, a shift from black to the dark blue that wasn't quite light yet but was no longer entirely dark either. She was holding her blood pressure cuff. She hadn't put it on yet. She was holding it and looking at the water and letting herself exist in the space before the number, because the number was going to say something she already knew, and she was allowed 30 seconds to be a human being who didn't know it yet. She heard Callum's footsteps before he reached her. She'd already learned the sound of them, steady, slightly uneven because of the way he was compensating for the arm, the soft sound of Ranger's pause between his steps. He stopped beside her at the window. Neither of them said anything for a moment. He's going to be suspended, she said, formally. The Federal Review is going to cover everything he signed tonight and apparently the Astoria incident reports as well. Good, Callum said. It doesn't feel like enough. She said it simply, not as a complaint, just as the true thing, the one underneath the professional framing. It's not enough, he said. But it's tonight. The rest comes in the days after. She looked at him sideways. He was watching the water. Your arm, she said. Needs surgery. They told me before the chaos. I'll schedule it next week. That's not... She stopped. You should not wait a week. I know. He said it without defensiveness. I'll do it Monday. I've been doing things on a delay for a while. I'm aware of the pattern. She looked at him. Something almost like a laugh moved through her chest, brief and warm, the first real one of the night. Put the cuff on, he said quietly. She put the cuff on. The number came back at 164/106. She looked at it for a long moment. Nora, Callum said. I know, she said. Her voice was steady, and the steadiness cost her something. I know. Ranger pressed himself against her side. She was still looking at the number when she heard footsteps in the corridor behind her. Multiple sets, moving with purpose, coming from the direction of the administrator's office. She turned. Commander Harrington was in the lead. Behind her were two people Nora didn't recognize. A man in his 50s wearing the administrative lanyard of the hospital board, and a woman in a white coat who had the bearing of someone considerably senior to anyone who'd been on this floor tonight. And behind them, moving between the agents in a way that no longer looked like a man who had prepared statements, was Warren Stiles. But Stiles wasn't the one looking at her. The woman in the white coat was. She stopped when she reached Nora, and she looked at the blood pressure reading on the cuff still strapped to Nora's arm, and her expression moved through several things in rapid succession before it settled on something that wasn't quite alarm but was adjacent to it. I'm Dr. Elaine Morrow, she said, Chief of Medicine. I was called in 20 minutes ago. She looked at the cuff reading. How long has your pressure been this high? Escalating over the past week, Nora said. Visual disturbances? Twice tonight, transient. Epigastric pain? Nora looked at her. Yes. Morrow looked at Harrington, then back at Nora. Her voice was very controlled. I need you in an exam room right now. Not in 10 minutes. Right now. She turned to the nurse behind her and said two words that Nora recognized as the OB emergency protocol. She said, call upstairs. And in the corridor behind Morrow, Warren Stiles, suspended, flagged, cornered, was watching. He was watching Nora get the urgent attention he had dismissed all night, the blood pressure reading that had been building all week while he was redirecting her to the charting room and telling her she was just a nurse, and whatever he was feeling as he watched it, his face had finally run out of versions to wear. Nora let Morrow take her arm. She let herself be moved toward the exam room. And she had one thought, clear and sharp and completely without satisfaction. She had known since Monday. She had known, and she had kept working because there was no one to cover for her, and the floor needed her, and she had pushed through because that was what she always did. In convoy vehicles, and forward surgical units, and overnight shifts in regional hospitals. And the number on the cuff was the cost of all of it finally presenting the bill. Her daughter moved. A slow, rolling shift. The same kind as before, but stronger now, more deliberate, as if the small person who'd been beside her all night had something to say about the direction things were going. Nora put her free hand against her side. I know, she said quietly. I've got you. And then Dr. Morrow's voice sharpened behind her, calling something toward the nurse's station. And Nora looked up and saw Callum in the doorway of the exam room, Ranger beside him, both of them still. Callum was looking at the monitor that the OB tech was setting up. The numbers it was pulling were bad enough that Nora could tell from the tech's expression before the machine finished its reading. The tech looked at Morrow. Morrow looked at Nora. And the monitor alarmed. The monitor alarmed, and the room moved. Not chaotically. It moved the way rooms moved when the people in them knew what they were doing, and what they were doing was urgent. Morrow was already at the bedside calling out numbers. The OB tech was on the phone to the unit upstairs. A second nurse appeared from the corridor with a blood draw kit and an IV setup and the specific expression of someone who'd been briefed en route. Nora lay on the exam table and let it happen. This was the hardest part. Not the blood pressure reading, not the monitor alarm, not the numbers that Morrow was reciting in the clipped, precise shorthand of a physician who was managing her own reaction while managing the situation. The hardest part was lying still while other people moved around her because her entire nervous system was trained for the opposite. Every instinct she had said, get up, assess, intervene, direct. Every instinct said the person in the bed was the passive one, and she was not a passive person and had not been one since she was 22 years old in a training facility in Virginia, learning how to be useful in conditions that were specifically designed to prevent usefulness. She lay still. She breathed. She let Morrow do her job. Protein in the urine? She asked, because she couldn't entirely stop being a nurse. We're pulling it now, Morrow said, but with this pressure and your symptom history, I'm not waiting for the lab to make a clinical determination. She looked at Nora directly, the kind of direct look that skipped the softening layer and went straight to the information. I'm calling this preeclampsia, severe range. We're moving you to OB for monitoring, and we're going to talk about delivery timeline. I'm 32 weeks. I know. Morrow held her gaze. 32 weeks in a hospital with a level 3 NICU is a very different situation than 32 weeks would have been 20 years ago. Your daughter is going to be okay, but we need to stabilize you first. Nora looked at the ceiling. The emergency lighting had been replaced by the ordinary overhead fluorescence of the exam room. The generators had fully restored power somewhere in the past hour without her noticing. And the light was flat and honest in a way that the red-orange emergency glow hadn't been. I should have come in Monday, she said. Yes, Morrow said. Not unkindly, just true. Nora closed her eyes for 3 seconds. Let the truth of it sit there without defending against it. Then she opened them. Magnesium sulfate? She asked. Starting now. Morrow almost smiled. You're going to hate how it makes you feel. I know. She'd administered it to patients. She knew exactly how it made you feel. Do it anyway. The IV went in. The medication started, and Nora lay in the exam room of her own hospital on the table where she'd stood on the other side of the procedure more times than she could count, and she felt the shift begin, the slight heaviness in her limbs, the warmth moving through her vascular system, the sensation of her own body chemistry adjusting to something foreign and necessary. Callum was still in the doorway. She hadn't forgotten he was there, but she'd been not looking at him, because looking at him made the situation feel more real in a way she wasn't ready for yet. Now she looked. He was watching the IV line with the focus of someone who knew what magnesium sulfate was and what it was for. His face was doing the thing it did when it was processing something and choosing not to broadcast the processing. You can go, she said. You've been here for hours. Your arm needs... I'll go when you're upstairs, he said. She didn't argue. She didn't have the energy to argue, and she wasn't entirely sure she wanted to. Ranger hadn't moved from beside the exam table. He'd been there since they brought her in, just inside the doorway, not in the way of anything but present. His breathing slow and even, and somehow the most stabilizing sound in the room. They moved her upstairs at 5:15. The corridor between the ER and the elevator bank took her past the nurses' station, and when the transport team wheeled her through, the department was there. Not assembled, not waiting, just there. The overnight staff finishing the last hour of a shift that had been the worst. Most of them had worked. Priya was at the station with a supply list. The second nurse, whose name Nora had never fully caught, was documenting in a chair. Delia was standing near the wall with her incident report in a folder, and her eyes tracking Nora's transport with an expression that didn't try to be anything except what it was. I'll come up when my shift ends, Delia said as the transport passed her. You should go home. I'll come up when my shift ends, Delia repeated. The transport continued. They passed the administrator's corridor on the way to the elevator, and through the glass partition she could see the room where Harrington and Alderman had set up their working space. The long table covered in document sleeves and tablets. The 2 additional agents who'd arrived sometime after 4, the organized infrastructure of a federal review that had been assembling itself while the ER managed its casualties. She could see the corner of Stiles' chair, empty now, and the folder that had been placed at the center of the table. She was almost past when Harrington stepped into the corridor and saw her. The commander gave her a single nod. Nora nodded back from the transport bed. The elevator doors closed. What happened to Warren Stiles in the hours after 5 in the morning was not something Nora witnessed directly, because she was upstairs in the OB unit with magnesium running through her system and a fetal monitor recording her daughter's heartbeat, and Dr. Morrow checking in every 30 minutes with the focused attention of someone who had decided this patient was her personal responsibility for the duration. But she heard it in pieces, the way you heard things in hospitals, through the specific channels of Delia, who came at 7:15 as promised, and sat in the chair by the bed with her folder and her 22 years of departmental knowledge. Through the brief report Harrington gave her in person at 9:40. When the commander came upstairs with Alderman and a tablet and a look that said the night had produced more than they'd initially expected. The folder on the table in the administrator's room had contained, among other things, a second personnel file. Not Nora's. Not the Meridian incident reports. Warren Stiles had maintained his own documentation. A private record, kept on a personal encrypted drive that NCIS had obtained access to through the Federal Review Authority. A detail that would have implications Nora was only beginning to understand. The record contained his assessments of staff members, written privately, maintained over 14 months. A running log of the people in his department and what he believed their weaknesses to be and how those weaknesses could be managed. Nora's entry was 11 pages. Delia's was 4. Dr. Okafor's was 3. The first-year resident Felicity Tan had half a page. She'd been there for only 4 months, and he'd had less time to build a profile. He documented everything he did, Harrington said, sitting across from Nora's hospital bed at 9:40 with the tablet in her hands. Including the rationale behind the duty reassignments, the fitness for duty consideration, the documentation decisions. She paused. He wrote it as a protective measure. He wanted a record of his reasoning in case any of it was challenged. She looked at Nora steadily. It is instead a complete record of a deliberate and sustained campaign to marginalize experienced staff he identified as threats to his operational control. Nora looked at the ceiling for a moment. 11 pages. You were the most significant threat on his staff, Harrington said. By his own assessment. The magnesium was making everything feel slightly underwater, which was its function. She knew that, understood the mechanism, could explain the pharmacology in her sleep. But the underwater quality meant her emotional responses were arriving slightly delayed, like signals from a distance. She felt something when Harrington said it, but the feeling came in slow and heavy rather than sharp. He buried my credentials, she said. When your application came to him for review, Hargrove Memorial uses a supervisory review process for all nursing hires in the ER department. He flagged your military service background as a potential integration challenge. His written note recommended you be hired with a modified orientation that emphasized civilian protocols over prior training. Harrington's voice was precise. Effectively, he used the hiring process to establish from day one that your previous experience was a liability rather than an asset. Nora thought about the welcome meeting, the 20 minutes about adjusted duties, the first week of orientation that had been 3 days longer than the other hires in her cohort, focused on civilian protocols she'd already understood, while her actual qualifications sat in a personnel file that nobody looked at. He was setting the frame, she said. From the beginning, Harrington confirmed, so that when the time came, if something went wrong, if his conduct was ever questioned, there would be an existing institutional record establishing you as a nurse who needed extra oversight and had difficulty with civilian adaptation, not a decorated corpsman who would immediately recognize what he was doing. The fetal monitor beside her registered a movement, her daughter shifting, the line on the screen jumping in the specific way that meant the baby was active and healthy and doing what babies at 32 weeks did when they'd been monitoring a stressful night from the inside. Nora looked at the line. The line settled. What happens to him? She said. Not a question about next steps. A question about outcome. He's been formally suspended with pay pending the internal investigation, which is now running concurrently with the Federal Review. The Federal Review will take priority for the VOS documentation. That's the element with criminal exposure. The internal investigation will address the conduct history, the personnel records, and the Meridian pattern. Harrington set the tablet on her knee. Based on what we have so far, his medical license will be referred to the Oregon Medical Board. The board has independent authority to act. She paused. He won't practice in this state again. I'm not going to tell you the timeline or the specific charges because both are still developing, but I want you to know the direction. Nora absorbed this. The nursing staff he targeted at Meridian, she said, the 3 who filed incident reports. We've made contact. Their statements are being incorporated. Harrington looked at her. You're not the first, but you're the one who was there when it fell apart. At 10:20 in the morning, the door to Nora's room opened and a man came in who was not a physician or a federal agent or anyone she'd seen during the night. He was in his early 60s, wearing a suit that was slightly rumpled in the way of someone who dressed quickly, and he had the look of a person who had been called with bad news and had spent the drive over deciding how to respond to it. He introduced himself as Dr. Gerald Ashworth, chair of the hospital board of directors. He sat in the chair beside her bed with the posture of a man who was doing something uncomfortable and had decided not to make it more uncomfortable by delaying it. I've been briefed by Dr. Morrow and by Commander Harrington, he said. I've also reviewed the summary of Dr. Stiles' personnel file and his private documentation. He stopped, started again. I want to start by telling you that what was done to you, the systematic undermining of your credentials, the fitness for duty action last night, the 14 months of deliberate marginalization is not something this institution sanctioned or was aware of. I want to be clear about that, and I want you to know that being clear about it is not the same as saying this institution bears no responsibility. It does. Systems that allow one person to operate unchecked for 14 months across 2 facilities have failed. Nora looked at him. She was tired. The magnesium and the sleepless night and the slow, sustained release of attention she'd been carrying for a very long time were combining into a weariness that was not unpleasant so much as comprehensive. What are you going to do about it? She said. He didn't appear to be surprised by the directness. Several things, some of which I can speak to now and some of which will require board authorization. Immediately, your clinical record at this hospital is going to be corrected to reflect your full credentials. Your military service record will be incorporated into your personnel file, with your permission, and a formal notation will be added to document that the initial orientation restrictions were imposed by a supervisor who has since been suspended pending investigation. He paused. Your salary classification will also be reviewed. Based on your actual qualifications, you've been compensated at the wrong grade for 14 months. She hadn't expected that one. Additionally, he said, I want to offer you a formal apology on behalf of this board. In person, in writing, and pure, if you're willing, in front of the department staff. He looked at her steadily. You saved lives last night. Multiple lives, by multiple methods, on multiple occasions, while managing a medical situation of your own that you should have been treated for days ago, in which you were instead actively discouraged from reporting to someone who could help you. He stopped. That apology should have more than one witness. Nora was quiet for a moment. My daughter first, she said. Make sure my daughter is okay. Then we'll talk about the apology. Ashworth nodded. He looked at the fetal monitor at the steady line. Is she? She's good, Nora said. She's been good all night. She looked at the monitor. She's tough. He stood. He was going to say something. She could see it forming. And then he thought better of it and simply said, I'll come back. He left. Delia, who had been sitting in the corner through the entire conversation with the folder on her lap and the specific expression of someone who was performing invisibility while missing nothing, looked at Nora. Back pay, Delia said. 14 months, Nora said. Delia looked at her lap. I've been at this hospital for 22 years. I have never once seen a board chair come up to OB at 10 in the morning. It's been an unusual night. It has. Delia was quiet for a moment. Are you okay? Nora thought about the real answer. The real answer was, not entirely. The real answer was that the night had taken something from her that she was going to have to account for in the days and weeks ahead, that the sustained cost of performing normality while her body was building a crisis was a bill that would keep presenting itself in forms she couldn't fully predict. That she was angry, not at anyone specific, or not only at anyone specific, but at the structure that had made it possible for one man's assessment of her worth to override 14 months of demonstrated competence. That she was also, underneath all of it, still here, still watching the fetal monitor track a heartbeat that was steady and strong and entirely indifferent to everything that had happened in the past 12 hours. Ask me tomorrow, she said. Delia nodded. Tomorrow, she agreed. At 11:55, Callum came upstairs. He hadn't left the building when she'd told him to. She'd suspected he wouldn't, but she'd told him anyway. He came into the room with Ranger, who the OB unit staff had allowed, with a combination of Callum's military credentials and the quiet authority of a man who did not ask permission so much as create the conditions under which permission became the obvious response. He looked at the monitors. He looked at her. He looked at Ranger, who had gone immediately to the side of the bed and placed his chin on the mattress. "Surgery Monday?" she said. "Monday," he confirmed. "Good." She looked at the ceiling. "You should know that your dog is probably going to be recruited." "By who?" "Harrington, Alderman, someone." She looked at him. He caught something in a waiting room that 11 trained medical professionals in the same room didn't catch. That's not something people forget. Callum looked at Ranger. Ranger looked at Nora. The three of them existed in the quiet of the room for a moment. The monitors running, the morning light coming through the window, the overnight shift finally, fully over. "She's okay?" he said. He meant the baby. "She's okay," Nora said. Loud heartbeat, very active. "She's been moving all morning." Something moved through his face that wasn't quite a smile but was in the neighborhood. "She gets that from somewhere." Nora looked at him. "Don't." "I'm just observing." "You're always just observing." "It's what I do." She would have said something else, but the door opened and Morrow came in with a tablet and the alert expression of a physician who had news to deliver and had decided on the approach. She looked at Callum and Ranger with the brief, evaluating glance of someone who had learned to assess situations fast. "Family?" she said. A pause. Nora and Callum looked at each other. "Yes," Callum said, before Nora could formulate an answer. Morrow accepted this without comment and turned to the tablet. "Lab results are back. Protein level confirms severe preeclampsia. I've consulted with the perinatologist." She looked at Nora. "We have a decision to make about delivery." Nora sat up slightly. The magnesium made the movement heavier than it should have been. "How soon?" she said. "That depends on how you respond to the magnesium in the next 4 hours. If your pressure stabilizes and stays there, we have more runway. If it continues trending up—" Morrow stopped. "I want to be honest with you. Based on where you are right now, I think we're talking about days, not weeks, possibly less." Nora looked at the fetal monitor, at the heartbeat line, steady and fast and present. "What do I need to do?" she said. "Right now? Let the medication work. Don't do anything." Morrow said it with the specific emphasis of a physician who knew exactly who she was talking to and was preempting the response. "I mean that literally, Nora. For the next 4 hours, your one job is to lie in that bed." Nora looked at the ceiling. "I can do that," she said. She was not sure she could do that. The fetal monitor beeped steadily. Outside the window, the morning had come in full. Gray Oregon coastlight, the kind that didn't show off, that came in flat and honest and lit things the way they were rather than the way you might want them to be. She could see the edge of the water from where she lay. She could see the port, which was still cordoned off. The investigation crews visible even from this distance as small moving shapes against the burned-out facility. And then her phone, which someone had retrieved from the ER and placed on her bedside table, lit up with a message from a number she didn't recognize. She reached for it. The message was from an internal hospital extension. The message had been sent at 11:43, 18 minutes ago, and it contained 3 words and an attachment. The 3 words were, "You should see this." She opened the attachment. It was a security camera still. Timestamp 2:41 in the morning. The angle was the corridor outside the supply station, and the image showed 2 figures, Warren Stiles in profile, and another man she didn't recognize, their heads close together in the specific posture of people having a conversation they didn't want overheard. The man Stiles was talking to was wearing a Hargrove Memorial administrative lanyard. She looked at the lanyard. She looked at the face. She knew that face. Not from the ER, from the administrator's office, from the man who had arrived with Harrington at 2:48 and who had been introduced as a board representative. The man who had been present when Alderman briefed the administrator. The man who had access to everything Alderman had shown the administrator's office in those first hours of the investigation. Stiles had been texting someone at 12:20 in the morning when the first federal agents arrived. She'd seen him. She'd noted it. She'd filed it and moved on because there were patients to manage. She looked at the security still. She understood what she was looking at. Stiles hadn't been managing his exposure alone. Somewhere in the hospital's administrative structure, he'd had a contact, someone who'd been feeding him information about the investigation as it developed, about what aldermen had found, about what was in the Federal Review. Someone who'd been in the room when the evidence was being assembled, and who'd walked back out and found a hallway with Stiles in it. The 3 words in the message were, "You should see this." She did not know who had sent it. She pressed the call button for her nurse with one hand and kept the phone in the other, and when the nurse appeared in the doorway, she said, "I need you to get Commander Harrington, right now." She looked at the image on the screen, at the lanyard, at the face, at the timestamp. "Tell her I have something she needs to see." Harrington arrived in 4 minutes. She came through the door with aldermen behind her and the tablet already in her hand, and Nora held up the phone with the security still on the screen before either of them had fully crossed the room. Harrington took the phone. She looked at the image. She looked at aldermen. She said nothing for approximately 5 seconds, which was the closest Nora had seen her come to a visible reaction. "Who sent this to you?" Harrington said. "I don't know. Internal extension? I don't recognize the number." Harrington handed the phone to alderman, who photographed the screen and then moved immediately to the doorway to make a call. Harrington looked at Nora. "The man in the image," Nora said. "He was in the administrator's office when you briefed the administrator. He was introduced as a board representative." "His name is Dale Ferris," Harrington said. "He's the hospital's deputy director of operations. He's been at Hargrove Memorial for 9 years. She paused. "I was in the room for the first 40 minutes of the briefing, before we moved to restricted personnel. He would have known what you found before Stiles did." "Yes." "Stiles was texting at 12:20. The briefing started at 12:04, Harrington said. "We've already flagged the gap. We didn't know who he was texting." She looked at the image on Alderman's phone. "Now we do." Callum was standing in the corner of the room where he'd been since before Morrow left, saying nothing, and Nora was aware of him the way she'd been aware of him all night. A steady, quiet presence at the edge of things, watching without inserting himself. Ranger had his chin back on his mattress. "What happens to Ferris?" Nora said. "Right now he's still in the building. He was asked to remain available for follow-up questions." Harrington's voice had the controlled quality of someone who was planning something and not broadcasting the plan. "He won't be for much longer." She handed Nora's phone back. "You should rest." "You're going to go get him," Nora said. "We're going to go have a conversation," Harrington said. She left. Alderman was already gone. Nora lay back against the pillow and looked at the ceiling and felt something in her chest that was not satisfaction. Not yet, not entirely, but was the beginning of what satisfaction felt like when you were too tired to fully inhabit it, and the magnesium was keeping everything slightly muted. It was the feeling of a machine that had been running against resistance for a very long time, finally finding the obstruction removed. Not relief, the absence of obstruction, which was its own kind of sensation. "Sleep," Callum said from the corner. "I'm not sleeping." "You should." "I know." She looked at the fetal monitor. The line was steady, the heartbeat fast and regular, the number exactly where Morrow needed it to be. "She's still good." "She's been good for 6 hours," he said. "She's going to be good in another 6. Nora closed her eyes. She did not sleep, but she stopped resisting the stillness, which was a version of the same thing. Dale Ferris did not leave the building voluntarily. She learned this from Delia, who learned it from the security desk, who had watched 2 federal agents escort Ferris from the administrative corridor to a conference room at 12:38 and had found the event significant enough to document in the security log. Ferris had walked cooperatively, which was the detail Delia delivered with the specific tone of someone who found cooperation under those circumstances more damning than resistance would have been. By 2 in the afternoon, Hargrove Memorial had issued an internal notice to all department heads advising that both Dr. Warren Stiles and Deputy Director Dale Ferris had been placed on administrative suspension pending investigation. The notice was 1 paragraph, carefully worded, and said as little as it was legally possible to say while still saying something. But it went to every department head, which meant it went to every charge nurse, which meant the department knew within 20 minutes. Nora heard about the notice from Delia, who read it aloud from her phone with the even voice of someone delivering a verdict they had been waiting a long time to hear. "Both of them," Nora said. "Both of them," Delia confirmed. The room was quiet for a moment. "He had help from the beginning," Nora said. "Ferris probably smoothed over the Meridian transfer. The incident reports that closed without finding, Someone with operational authority had to sign off on those closures. 9 years, Delia said. Ferris has been here 9 years. Stiles was hired 6 years into that. She looked at her folder, the incident report she'd been carrying since the night before, the one she'd finally written. He didn't arrive at Hargrove Memorial by accident. Nora thought about that, about the specific architecture of it. Not the dramatic version, not a conspiracy with clean lines and documented coordination, but the ordinary human version, which was messier and more recognizable. Two men in adjacent positions who had each accumulated just enough unchecked authority to protect each other's blind spots. Ferris smoothing administrative friction, Stiles managing clinical liability. Each one making the other's failings slightly harder to see. It wasn't sophisticated, it was just sustained. And it had worked, right up until the night a retired military dog refused to move from in front of a pregnant nurse in a waiting room. Nora looked at Ranger. Ranger looked at her. "Don't let him get a big head about it," Callum said. "He already has a big head about it," she said. Callum almost smiled. Morrow came back at 3:15 with the perinatologist, a tall, quiet woman named Dr. Patricia Feld, who had been called in that morning and who approached the bedside with the specific economy of movement of someone who had been doing this for a long time and had learned to use only the space and time the situation actually required. Feld looked at the monitors. She looked at the lab results Morrow handed her. She pressed 2 fingers briefly to Nora's wrist and then to her abdomen, and she did all of it without narrating the process, which Nora respected more than she could have explained. "Your pressure has come down 4 points in the last 2 hours, Feld said. "Not enough to feel good about, but the direction is right." She looked at Nora directly. "Here's what I can tell you. Right now, today, the baby is not in distress. Your numbers are severe but responding to treatment. We have room to watch and wait through the next 24 hours and possibly beyond, depending on how you trend." She paused. "What I need from you is complete rest. Not relative rest. Not rest between checking on things. Absolute. If your pressure drops below 150 systolic and stays there for 4 hours, I feel considerably better about the next week." "And if it doesn't?" Nora said. "Then we have a different conversation and we make a different decision. But I want to give the medication time to work before we get there." Feld looked at her steadily. "You've been managing this for a week on willpower and adrenaline. Both of those are gone now. Let the medication do it." Nora looked at the fetal monitor. "She'll be okay," she said. It wasn't entirely a question. At 32 weeks in this unit, with the monitoring and intervention capacity we have, she has every advantage we can give her. Feld said it the way physicians said true things that weren't the whole truth. Not dishonestly, but with the awareness that medical certainty was a spectrum and that functioning on the better end of that spectrum required information and active management. "We're going to give her everything." Nora nodded. Feld left. Morrow lingered for a moment at the door. "You did good last night," she said. It came out of nowhere, which was exactly the way Morrow delivered things. Without preamble, without softening structure. Just the statement. "I want you to know that the board's conversation this morning was considerably more than an apology. There are going to be structural changes in how this department is supervised and how clinical credentials are reviewed at the hiring level. Ashworth asked me to be part of that conversation." "Good," Nora said. "I told him you should be too." She paused. "When you're ready." She left before Nora could respond. Whoa. The formal board meeting happened on a Thursday, 11 days after the night of the port explosion. Nora was still in the hospital, not in the OB unit anymore, having been discharged and readmitted twice in the intervening days as her pressure stabilized, destabilized, and stabilized again in the grinding, non-linear way of a body managing a complicated medical situation without the benefit of a clear narrative arc. Her daughter was still inside her, heartbeat steady and stubborn, apparently determined to remain on her own schedule. The perinatologist had moved the delivery target to 34 weeks, then revised it to 33, then settled on monitoring day by day with the honest pragmatism of someone who had stopped making promises about timelines. Nora had spent 11 days learning to be a patient. It was the hardest thing she'd done since the convoy, not because of the physical aspect, the medication, the monitoring, the restricted movement, the institutional food she ate without complaint because complaining would have cost her more energy than it returned. The hard part was the stillness required, the suspension of the reflex that said, assess, act, correct, move. The daily exercise of lying in a bed while things happened that she could not control and which she was not being asked to manage and which were, in fact, being managed well without her. She had never been good at that. She was getting better at it by necessity, which was not the same as being good at it. Callum came every day. She hadn't asked him to. He came anyway, in the afternoon after whatever physical therapy his shoulder required. Ranger walking beside him with the comfortable authority of a dog who had decided this was part of his routine now. They didn't always talk much. Sometimes he sat in the chair and read something on his phone while she slept. Sometimes they talked about things that had nothing to do with the hospital or the investigation or the delivery timeline, about the water, which she could see from her window, about the specific quality of Oregon coast light in November, about the 6 years she'd spent in uniform and the 8 years he'd spent in his, trading information about places they'd both been without ever quite finding the overlap, which they both agreed was either coincidence or the military's standard policy of keeping people from comparing notes. It was not a romantic situation. It was something less defined than that, and possibly more durable. The specific connection that formed between two people who had been present for each other during something real before they had the information necessary to perform a version of themselves. She did not know what it would become outside of this building. She knew what it was inside it, and what it was inside it was enough. On the Thursday of the board meeting, Ashworth came upstairs before the meeting began. He sat in the chair and he looked at her with the expression of a man who had spent 11 days looking at things he should have looked at years ago, and who was going to have to live with the gap between what he'd seen and when. "The meeting today," he said. "Several items. I want to brief you before it happens." "Okay," she said. "The NCIS investigation has produced enough for the Oregon Medical Board to open a formal licensing inquiry into Stiles. The board has been notified. That process will take months. Medical licensing boards don't move fast, and Stiles has legal representation. But the inquiry is open, and the Meridian records are part of it." He paused. "His ability to practice while under inquiry is suspended by agreement. His lawyer negotiated that rather than a forced emergency suspension, which tells me his lawyer looked at the evidence." "He won't practice," Nora said. "Not in this state, and with NCIS involved. Not federally either. He'd need clearance to work in any facility connected to government contracts, which is most major medical systems." Ashworth's voice was careful but not detached. He was tracking what he was saying and what it cost. "He's done." Nora looked at the window. "Ferris," she said, "terminated this week. The investigation established that he had prior knowledge of the Meridian reports and actively facilitated Stiles' transfer to Hargrove Memorial by removing those reports from the pre-hire review documentation. He didn't forge anything. He simply chose not to include them in the packet that went to the hiring committee." Ashworth paused. "It was the kind of thing that's very hard to prosecute because it happened through omission, but it's not hard to terminate over. Will there be legal action?" "That's being evaluated by the federal prosecutor's office. The connection to the Voss case. A federal contractor whose delayed treatment was directly connected to a documentation pattern Ferris had knowledge of, creates possible exposure. I can't predict the outcome." He looked at her. "I'm not going to promise you they both go to prison. I don't know if they will. What I can promise you is that neither of them will be in a position to do this to anyone else." She thought about that, about what it was worth and what it wasn't, about the nurses at Meridian who had filed reports that went nowhere, about Felicity Tan sitting in the break room with cold coffee and 3 years of medical school debt and the face of someone who thought she had missed something she hadn't missed, about the 14 months she herself had spent performing competent invisibility in a building where one man had spent the same 14 months constructing the narrative that made her invisible. "It's something," she said. "It's not enough," Ashworth said. "No," she agreed. "But it's something." He nodded. "The board meeting today is going to formally adopt 3 structural changes. Supervisory review of hiring credentials will move to an independent HR committee. No department supervisor has unilateral authority over the credential review process. All military service records submitted by applicants will be incorporated into their personnel files with the same weight as civilian credentials, not as supplementary material. And a whistleblower protocol is being established that creates a direct reporting channel to the board that bypasses departmental supervision." He paused. "That last one came from Delia Marsh." Nora looked at him. "She submitted a 12-page memo," he said. She CC'd me, the board secretary, and Commander Harrington. A brief involuntary expression, not quite a smile. It was very thorough. She has 22 years of things she's been watching, Nora said. I know. He stood. The meeting is at 2. We're also going to formally recognize your service to this hospital last night, to the department, and to the patients who were in it. He looked at her steadily. I'd like you to be there. I know that's a request, not a requirement, and I know you're in a hospital bed, so wheel me in, Nora said. He blinked. I'm not going to miss it, she said. Wheel me in. They wheeled her into the conference room at 2:15 on a transport bed with the fetal monitor still attached and a nurse walking beside her who had agreed to this with an expression that mixed professional concern with the visible understanding that she was not going to win this particular negotiation. The room was not a small conference room. Ashworth had opened the board meeting to department staff, which meant it was the large room on the 3rd floor that Hargrove Memorial used for annual reviews and emergency preparedness briefings, and it was full. The overnight ER staff was there. Priya, the second nurse, the tech who'd kept reaching for instruments in the wrong order, and who had, Nora had learned, spent the 11 days since the explosion. Volunteering for extra shifts with a determination that suggested he was working something out. Okafor was there, standing near the back with the composed presence of a physician who had processed a difficult night and emerged from it with her competence confirmed and her confidence quietly expanded. Felicity Tan was near the door. Delia was in the front row with her folder. Of course she was. Commander Harrington was there in full-dress uniform, which told Nora this had been coordinated and which she hadn't been warned about, and which made the back of her throat do something she refused to let become visible. Callum was against the wall on the left side of the room. Ranger sat beside him. Neither of them was in the front. Neither of them needed to be. Ashworth ran the meeting efficiently. The board resolutions were read and adopted. The structural changes were outlined. The names of Stiles and Ferris were spoken without drama, and their status was stated clearly and on the record, which was the kind of clarity that institutions often avoided, and which Ashworth had apparently decided to stop avoiding. Then he turned to the transport bed and said, Nora Calloway. The room was quiet. Read her service record. All of it. The deployment history, the forward surgical element, the convoy, the commendation. He read the citation in full. The room stayed quiet through all of it, the quality of quiet that collected around things people hadn't known and were now recalibrating around. He read what she'd done on the night of the explosion. The bay rerouting. The internal injury catch on arrival, room 6, the dosage correction, the chart. The 7.5 hours she'd run the practical operation of a mass casualty response while managing her own medical emergency without telling anyone because there was nobody available to cover the gap she'd have left. When he finished, he said, This hospital failed this woman in a way that this board will not minimize or qualify. We are not here today to celebrate that she overcame the obstacles we permitted to exist. We are here to acknowledge that those obstacles should never have existed, and that what she accomplished in spite of them speaks not to exceptional circumstance, but to the character and capability of a person this institution was privileged to have and did not have the honesty to recognize. He looked at her. I'm sorry, he said. We are sorry. The room began to applaud, and she made herself look at it, at all of them, at Priya, who was clapping with the relief of someone whose experience of the night had been instructive and frightening and who clearly needed to put it somewhere, at Okafor, who clapped with the measured appreciation of a physician who had worked beside her and knew what the night had actually cost. At Tan, who was crying in the way of someone who had been carrying guilt they now understood wasn't theirs. At Delia, who wasn't clapping, who was standing in the front row looking at Nora with the expression she wore when she didn't need to perform anything, direct, warm, and tired in the way of someone who had been waiting a long time for a room to catch up to what they already knew. Nora looked at Delia, and Delia gave her the small nod that meant, yes, this, finally. Harrington stepped forward. She had a folded document in her hand. She unfolded it and held it so that Nora could see the letterhead, Navy Medical Command Pacific, and she said, in the voice she used when the occasion required that words carry weight, on behalf of Naval Medical Command and in recognition of service that this record confirms and this institution failed to acknowledge, your commendation citation has been updated with a formal notation of record, and your service history has been entered into the permanent file of the Navy's Veteran Medical Personnel Registry. That registry is used to identify qualified personnel for federal emergency medical response programs. She looked at Nora. "You're still in the system," she said. "If you want to be." Nora looked at the document. She thought about the version of herself that had come to Port Carver 4 years ago trying to be a civilian, trying to find some version of ordinary that would fit over what she'd done and seen and carried. She had tried to become just a nurse, not because she was less than she'd been, but because she'd needed to stop being someone who operated in emergencies. And the only way she'd known how to do that was to remove herself from the context that created them. It hadn't worked, not because she'd failed at it, but because what she'd learned in 6 years of operational medicine wasn't a professional credential she could set aside. It was the way she saw things, the way she moved through a room, read a situation, identified the variable that everyone else was too close to see. You couldn't take that out and put it in a drawer. You just had to decide what you were going to do with it. She had spent 14 months trying not to do anything with it, and the night of the port explosion had happened anyway. Maybe that was the thing about being good at something. It didn't wait for your permission. "I want to be," she said. Harrington folded the document and handed it to her. The applause came again, and this time she let herself be in it rather than beside it. Nora's daughter was born on a Sunday morning at 33 weeks and 1 day, via cesarean section under a spinal block, in a room that was smaller than she'd imagined and louder than she'd expected, and considerably less organized than any operating environment she'd ever worked in, which she found unexpectedly reassuring because the disorder meant everything was happening fast, and fast was the right speed for this. She heard the cry before she expected to. Not the newborn cry from movies, thin, immediate, theatrical. The real version, which was sharper and more startled and more alive than anything she'd been prepared for, and which arrived so suddenly that her own breath stopped for a second in the very specific way of a person who has just understood something they previously only knew. They held the baby up briefly, red, furious, absolutely certain of her own opinion about what was happening, and Nora saw her for 2 seconds before the NICU team took her to the warmer, and those 2 seconds contained more information than her brain could process in real time, which was fine. She would process it later. She would have the rest of her life to process it. "She's breathing," the neonatologist said from somewhere to her left. In the tone of someone delivering news they are relieved to deliver. "Strong response. Good cry." Nora looked at the ceiling. She did not cry. She made the decision not to, and then she cried anyway, which was a different kind of decision. Her daughter's name was Margot. She had decided this 2 weeks before and had not told anyone, which meant that when she told Delia in the recovery room an hour later, Delia looked at her with the expression of someone who would have had opinions about the name if asked, and was now deciding to let it go. "Margot," Delia said. "Yes." "It's a good name." "It is." "You could have asked me." "I didn't need to ask anyone," Nora said. "That's the point." Delia looked at her. Then she sat back in the recovery room chair and said, "Yes, that's the point," in a tone that meant she understood. Callum came with Ranger when visiting hours allowed, which at the NICU was a specifically negotiated arrangement that involved Callum's credentials and a nurse manager who turned out to have served in the Coast Guard for 5 years and who cleared it in under 3 minutes. Ranger sat outside the NICU window and looked at the incubator where Margot was sleeping with the tubes and monitoring wires that characterized the first weeks of a premature life, and Callum stood beside Nora as she looked through the glass. "She looks annoyed," he said. "She is annoyed," Nora said. "She had more time in there." "You'd be annoyed too." "I am annoyed," Nora said. "She got it from me." He was quiet for a moment. "She's going to be fine." "She's going to be fine," Nora agreed. It was not hope. It was the statement of someone who had made peace with uncertainty by deciding to operate from the better end of it, which was not delusion but was a practice, the same way everything she'd ever been good at had been a practice. Margot's hand, visible through the incubator wall, was curled into a fist the size of a bottle cap. Even in sleep, she was holding on to something. Nora put her hand flat against the glass. The formal investigation closed 14 weeks later. The Oregon Medical Board revoked Warren Stiles' medical license following a proceeding that lasted 3 days and produced a finding of conduct, unbecoming a licensed physician, falsification of clinical documentation, and willful endangerment of a patient, Harlan Voss, the federal contractor from Room 6, who had recovered from his surgery and who had submitted a written statement to the board that was 3 pages long and which, according to Harrington, who had read it, contained several sentences that would not have been out of place on the walls of the room. Stiles's license was revoked permanently. He would not be able to refile for reinstatement. The finding was public record. Dale Ferris reached a civil settlement with the hospital that included a non-disclosure provision Nora suspected contained more than the hospital's press release suggested, but whose existence told her that the hospital's legal team had found enough exposure to make the settlement preferable to litigation. Ferris did not face criminal charges. The federal prosecutor declined to indict on the obstruction by omission theory, which Alderman had explained to her was a prosecutorial judgment call rather than an exoneration, a distinction that mattered even when it didn't change the outcome. He was done. He was just done without a conviction, which was the version of justice that didn't feel like justice, and which she had to find a way to file somewhere workable. She worked on it. Hargrove Memorial's board approved all 3 structural changes from the Thursday meeting. Delia Marsh was appointed to the Independent Credentials Review Committee, which Delia accepted without ceremony, and immediately showed up with a 12-page document of recommended protocols that the committee chair later described as comprehensive, in a tone that strongly suggested he'd meant something more intense than that. The emergency preparedness program that the hospital developed over the following 6 months drew on the triage protocols Nora had improvised the night of the port explosion and refined into something teachable. She ran the first training herself, 8 months after the explosion, standing in front of 20 ER staff members in the hospital's conference room with Margot in a carrier on her chest, because the babysitter had canceled and Delia had told her to come anyway. Nobody complained about the baby. Margot slept through the first 40 minutes of the presentation and then woke up and looked at the room with the specific alert assessment of a child who had spent the night of her most formative prenatal experience in the middle of a mass casualty event and seemed to find the room less interesting than expected. "She has your face when you're evaluating a situation," Callum said afterward, from the back of the room where he'd been for the whole session with Ranger. "She has her own face," Nora said. "Her own face looks like yours when you're evaluating a situation." Nora looked at Margot, who had found something in the middle distance and was examining it with the solemn intensity of an 8-month-old with opinions. She looked at Callum. "You've been watching me evaluate situations for 9 months," she said. "I have," he agreed. "That's a lot of data." "It is." He said it simply. "I wanted to make sure I was right." She looked at him. He looked back. "Are you?" she said. "Yeah," he said. "I am." She let that sit. She wasn't going to make it easy. She had earned the right not to make things easy, and he seemed like the kind of man who preferred the accurate version of things to the comfortable version anyway. "We'll see," she said. "Fair enough," he said. Ranger looked at Margot. Margot looked at Ranger. Some assessment was conducted between them that Nora couldn't decode and which seemed to conclude satisfactorily, because Margot made the sound she made when she'd decided something was acceptable, and Ranger's tail moved once. There was a photograph taken the night of the port explosion. Security camera footage, not a posed shot. The timestamp in the corner said 4:42 in the morning, and the angle was from the secondary corridor camera, and it showed the alcove at the end of the hallway where Nora had stood at the window with the blood pressure cuff. In the image, she was sitting on the floor of the alcove with her back against the wall. Not at the window anymore, but below it, which was where she'd apparently ended up sometime between Morrow's arrival and the transport upstairs, in the minutes that she'd spent letting herself exist in the space where she didn't have to manage anything. Callum was beside her, not touching, his sling visible, looking at the monitor she'd left on the floor between them. Ranger was across both of their legs. Not as a deliberate gesture. He'd simply lain down there, the way he went where he decided he was needed, and neither of them had moved him. The photograph was printed and placed in the emergency department. Not with ceremony. Delia had it framed and put it on the wall beside the supply station, which was not a glamorous location. It was next to the PPE dispenser and across from the medication cabinet, but which was the location that every nurse in the department passed at least 4 times per shift, and which meant that nobody who worked that floor went a day without seeing it. Beneath the photograph, in letters that Delia had printed on a label maker at 11:30 on a Tuesday night, because that was the kind of person she was, were the words, "Never mistake quiet for weakness." Nobody removed it. Nobody asked who had put it there. It simply became part of the wall, the way that certain things become part of the architecture of a place, not because they were installed with authority, but because they were true and the room recognized them. Harlan Voss came to the hospital 4 months after his discharge to attend a public meeting about the port incident. He stopped at the ER beforehand. He asked for Nora and was told she was in a meeting. He left a note at the nurse's station that said, "Thank you for room 6. I know it wasn't just you, but it started with you." Delia kept the note. Nora read it once and put it in a drawer and did not look at it again because she didn't need to. She already knew what it said. She had known since the night she'd pressed her hands against a man's abdomen in a chaotic bay and understood in under 3 seconds what the visual evidence had missed. She'd known because she'd been trained to know, and because 14 months of being told she didn't know what she knew had not changed what she knew, only who she'd been allowed to say it to. That was the thing about being dismissed that nobody told you going in. The dismissal didn't change what you were. It only changed the range of what you were permitted to do. And there was a difference between those two things that was enormous. And it was the distance between them that people like Stiles depended on. The gap between who you actually were and how much of that you were allowed to be in any given room. She had stopped closing that gap. Not through performance, not through a deliberate campaign to prove anything to anyone, simply by refusing, in the daily and granular way of a person going to work and doing their job honestly, to pretend the gap existed. Margot was 4 months old when Nora went back to the floor, not to the same role. Hargrove Memorial had created a position that hadn't existed before, Clinical Emergency Preparedness Coordinator, a hybrid role that sat between nursing practice and administrative protocol, and which paid at the grade her actual qualifications warranted, which was considerably above what she'd been receiving. She designed the triage protocols. She ran the trainings. She maintained her clinical hours in the department because she'd asked for them, because the protocol design was better when she was still inside the work rather than looking at it from outside. She was not invisible in this role. That had taken some adjustment. Not in the way she'd expected. She'd assumed returning to visibility would feel like exposure, like presenting herself again to the assessment of people who might dismiss her, who might measure her against some standard she didn't meet, who might look at a 32-year-old woman with a 4-month-old and a military background and a complicated recent history and decide she was less than she was. Some people did that. She'd learned to account for it without being stopped by it. What surprised her was how much of the adjustment was internal, how many of the habits she'd built over 14 months, the automatic minimizing, the instinct to soften her own assessments, the specific social calculation of how much knowledge she could display before it became threatening, had embedded themselves deeply enough that she had to actively notice them to change them. She wasn't always fast at it. She caught herself hedging in meetings and stopping and restating without the hedge, and sometimes the restating felt awkward, and she did it anyway. She was imperfect at being seen. She worked at it. On a Thursday in March, 8 months after the explosion, Nora was at the nurses' station reviewing the updated mass casualty protocol, when the external doors opened and a young woman walked in, mid-20s, in scrubs, the specific look of someone recently arrived and not sure of the geography yet. New hire. Nora could tell from 6 feet away. The young woman stopped at the desk and gave her name and said she was reporting for her first shift. The desk clerk started pulling paperwork. Nora looked at her for a moment. She had the particular quality of competence before confidence, the kind that showed up in the way she held herself, the way her eyes moved across the room, taking inventory without needing to announce that she was doing it. She was going to be good. Nora could see that without knowing anything else about her. She walked over. "I'm Nora Calloway," she said. "Clinical coordinator. I'll be part of your orientation." The young woman, her name tag said K. Warren, looked up with the alert expression of someone surprised to be addressed directly. "Yes, ma'am," she said, and then looked slightly uncertain about the form of address. "Just Nora," she said. "Tell me your background." Warren looked at her. Then she stood up slightly. Not defensively, but the way people stood up when they decided to stop waiting to be asked for less than they had. "Army," she said. "Combat medic. 88th Division. 4 years, 2 deployments." She paused. "I just finished my nursing degree." Nora looked at her. "Good," she said. "Come with me. I'm going to show you how this floor actually works." She walked. Warren followed. And somewhere at the edge of the station, invisible except to the people who knew where to look, Ranger raised his head from where he'd been sleeping on Callum's jacket. Left behind that morning when Callum went to his follow-up appointment, a standing arrangement by this point, and tracked the two of them until they moved through the corridor doors. Then he lowered his head again and closed his eyes. The department ran on. Outside the window, the Oregon coast went about its business in the flat, honest November light. The water moving the way water moved without asking permission, the port operating again with the ordinary noise of industry, the town of Port Carver doing what towns did, which was continue. Nora Calloway walked down the corridor beside a young woman who had spent 4 years learning to be useful in conditions specifically designed to prevent it. And she thought about nothing in particular, and she felt the specific satisfaction of someone who had stopped pretending they were less than they were and had discovered, on the other side of that pretending, that the world did not collapse. It adjusted. It always did when you stopped making yourself small enough to fit inside someone else's idea of what you should be. She had a daughter who slept with her fists closed and her chin up, and who had, according to her pediatrician, an unusually strong grip for her gestational age. She had a department that had her photograph on the wall. She had a man who was right about things and said so without apology and expected the same from her, which was the most honest form of respect she knew. She had work she was good at, done in a building that now knew she was good at it. She had herself, finally, without the footnotes. That was enough. It was more than enough. It was the kind of more that made the word enough feel too small for what it was describing. The ordinary, extraordinary condition of a person who had fought their way back to their own full size and was finally, simply, taking up the space they'd always been entitled to. She pushed through the corridor doors.